Good morning, everyone. I would like to call to order this public hearing of the Committee on the Judiciary and Public Safety. It is 10:19 a.m. on Thursday, February 8th, and 2024. We are conducting this hearing in person uh, in the Wilson Building in room 412 and streaming virtually on the DC Council's website and YouTube at CM Brooke Pinto. I'm Councilmember Brooke Pinto, representing Ward 2 and Chairwoman of the committee. The Committee on the Judiciary and Public Safety has oversight responsibility for matters affecting the district courts, criminal law, procedure and justice, public safety, including policing, violence prevention and intervention, civilian police oversight, access to justice, including victim services and justice grants, fire and emergency medical services, and the district's 911 and 311 services, forensic science, fatality review and medical examinations, homeland security and emergency response, adult and youth corrections, family law, probate and estates, and child support and women's and gender policy. Today, the committee is meeting to conduct performance oversight hearings for two agencies under its purview. We will hear from first the Office of the Chief Medical Examiner and then the Office of the Unified Communications. We will hear first from the Office of the Chief Medical Examiner, or OCME. OCME is an important part of our public safety ecosystem. The agency investigates all deaths in the district that occur as a result of violence, as well as those that occur unexpectedly without medical attention, in custody, or pose a threat to public health. OCME provides forensic services to government agencies, healthcare providers, and citizens of the DC metropolitan area to ensure that justice is served and to improve the health and safety of the public. The fatality review committees that OCME oversees are responsible for reviewing the circumstances of the deaths of individuals within certain populations, including their interactions with DC government services. Those review committees then provide analysis and recommendations to the public and district entities serving the defined populations so they can address systemic problems and provide better service. And this is really important for improvements in our services in the district government to understand where we went wrong and where we can do better in the future. I'll be interested to hear from the agency about any challenges in resources and staffing the agency may have faced for caseloads and fatality review work, given the rise in homicides and the crisis of violence the district has been grappling with. I will also be curious to discuss some of the fatality review work, such as whether there are any overarching trends, concerns, or recommendations from the fatality review committees and boards that the council should be aware of. There are no public witnesses today for OCME, so I would like to call our government witness, Chief Medical Examiner, Dr. Francisco Diaz. It's very nice to see you again, Dr. Diaz. Thank you for joining us. As you know, it is the tradition of this committee to swear in all government witnesses who appear before it. And hello, if you'll be answering questions as well, could you please state your name and title for the record? Thank you all very much. Do you swear or affirm under penalty of law that the testimony you're about to provide to the Council of the District of Columbia and this committee is the truth, the whole truth, and nothing but the truth? Thank you. Please take a seat. I'd now like to invite you, Dr. Diaz, to make any opening statement you may have.
Thank you, Madam Chairperson. I would like to take a few seconds to introduce part of my team that accompany me today. To my left, as she introduced herself, is Ms. Beverly Fields, Chief of Staff for OCME. To my right is Ms. Jenna Bibi Irick, who is the manager for the Fatality Review Committees. And sitting to my right in the public section is Mr. Rodney Adams, who is the General Counsel for OCME, as well as Ms. Shelley Graham, who is the financial officer for the Public Safety and Justice Cluster, and also Dr. Samantha Tolliver, who is the head of the Postmortem Forensic Toxicology Laboratories for OCME, as well as for the Breath Alcohol Program and the Drug Facilitated Sexual Assault Laboratories, also run by OCME. And with your permission, I would like to read my statement. Good morning, Chairperson Pinto and members of the Committee of the Judiciary and Public Safety. I am Dr. Francisco J. Diaz, Chief Medical Examiner for the Office of the Chief Medical Examiner, OCME. I am joined today by my executive staff, which I already introduced. Mayor Bowser's fiscal year 2023 budget, a fair shot, built upon those COVID-19 recovery efforts that have been implemented over the past few years to bolster core city services, improve the experience of residents and business interacting with DC government, and provide greater opportunity for residents to learn, grow, and thrive. Our agency supported the efforts to come back stronger than before as we work each day to fulfill our statutory mandated mission, which is to perform accurate and timely medical legal death investigation. Our agency background. The agency priority is to perform its mission by serving our families during a time when they are most at need, the sudden and unexpected loss of their loved one. We implement the mission 24 hours a day, 7 days a week, 365 days a year, via effective and efficient operations. The agency is comprised of 4 divisions. The administrative division is responsible for oversight of operational and programmatic functions to include personnel management, training, labor relations, contracting and procurement, risk, fleet, property and financial management, information technology, legal services, communications, and agency performance management. Our death investigation division includes forensic pathology, which involves conducting decedent examination and certifying the cause and manner of death, forensic investigation, which includes death scene response, medical records review, and provision of information to aid in the determination of the cause and classification of the manner of death. Anthropology and Identification Unit, which administer the agency's decedent identification program, and a histology laboratory, which processes samples of tissue in support of cause and manner of death findings. Mortuary Services, which provides body disposition and autopsy support to forensic pathology staff and the funeral industry. And finally, the Medical Examiner Transport Team, which ensures timely response and removal of decedents from scenes, homes, hospitals, and extended health care facilities for examination and disposition by OCME. The third division is the Forensic Toxicology Laboratory, which is responsible for the detection, identification, quantitation of alcohol, drugs, and other toxins in biological specimens. The laboratory provides scientific support services to postmortem testing so that the agency may provide accurate death investigation and certification information in a timely manner to next of kin, law enforcement agencies, legal counsel, and the community when required. The Forensic Toxicology Lab Division also administered the District Alcohol Breath Program and toxicology analysis for the Sexual Assault Response Team, SART. The fourth division of OCME is Fatality Review, which facilitates the reviews by committees of the circumstances of the death of individuals within certain populations, including their interaction with district government services. The purpose of the reviews is to provide analysis and recommendations to the public and district entities serving defined populations so they can address systemic problems, provide better services, and be held accountable. The Fatality Review Division currently supports 6 Fatality Review Committees: Child Fatality Review, Infant Fatality Review, Developmental Disabilities Fatality Review, Maternal Mortality Review, Violence Fatality Review, and finally, Opioid Fatality Review Board. During my testimony, I will highlight the agency's work during fiscal year 23 in key areas, including 1, the agency accreditation status, 2, death investigations, 3, forensic toxicology, 4, training and professional development, and 5, fatality review operations. Beginning with accreditation status, I'm proud to report that the agency was successful in fiscal year 23 in obtaining reaccreditation from the National Association of Medical Examiners, which consists of an annual review held during the full accreditation period that runs from February of 2021 to February of 2025. The agency also maintains accreditations with the International Organization for Standards, also known as ANAP, and the Accreditation Council for Graduate Medical Education. The agency's forensic toxicology laboratory has maintained the following accreditations: ISO ANAP 17025 for forensic testing, ANAP for the breath alcohol program, ISO or ANAP 17025 for calibration, and also accreditation by the American Board of Forensic Toxicology. In January of the year 2023, the breath alcohol program received its official accreditation, a first for the program. In August of the same year, the breath alcohol program underwent its surveillance and had 0 nonconformities. Additionally, in August, the toxicology testing laboratory had its first ISO 17025 inspection with 0 nonconformities. The testing lab also maintained its American Board of Forensic Toxicology accreditation with 1 nonconformity. The laboratory has corrected the nonconformity and no further action is needed. These accreditations are a direct result of the agency's strong quality program that includes adherence to accrediting body guidelines and best practices, implementation of continuous process improvement and quality control measures, and provision of academic and professional training. In fact, the quality program has also resulted in meeting or exceeding the agency initiative and key performance indicator, many of which are tied to accreditation, to include post-mortem examination reporting, forensic toxicology testing, fulfillment of customer record requests, and timely reporting to death scenes. Through this rigorous and successful accreditation process, the residents of the district can have confidence that the agency mission is being met and that the agency is implementing quality death investigation and certification per industry standards and best practices. Death investigation. The agency's death investigation division is supported by forensic pathologists, an anthropologist, medical, legal, and forensic death investigators, forensic photographers, autopsy technicians, transport technician, histologist, pathologist assistant, and identification specialist. During fiscal year 23, these dedicated staff members work in cooperation in investigating, processing, and determining the cause and classifying the manner of death for 1,971 cases, an increase over fiscal year 22 caseload, which was 1,869. This includes accidents, homicides, natural cases, suicides, and undetermined cases, as well as review of medical records. In addition, the postmortem caseloads, the agency is responsible for processing about 3,700 cremation requests and approximately 150 storage cases. Over 2,000 autopsy report requests from next of kin, law enforcement, legal entities, such as the United States Attorney's Office, hospitals, as well as investigating about 4,500 cases, of which 2,000 are eventually declined as they are not within the agency's jurisdiction. It is important to note the increasing caseload, particularly over the last 5 years. For example, the number of homicides has increased by 62% since 2019. Such increases impact the supplies, equipment, and staffing required to carry out the agency's mission of death investigation. Despite this increasing caseload, critical agency key performance indicators were met and or exceeded. For example, 89% of all reports of postmortem examinations were completed within 90 calendar days from the time of autopsy, which is slightly below the 90% target. 96% of scenes were responded by our transport technician within an hour of notification of unaccepted cases, significantly exceeding the 90% target. Moreover, through innovative use of its human and physical resources, the agency continues also and completed its strategic initiative, resulting in increased efficiency and effectiveness in agency operations. However, the agency continuously monitors its resource needs to ensure a solid foundation to support the agency mission, as well as continuous operational improvement. Forensic toxicology. The Forensic Toxicology Lab works in partnership with the agency's Death Investigation Division towards certifying death. In fiscal year 23, the lab tested 1,358 medical examiners cases. Of note, however, is that the laboratory services are utilized by external entities such as Metropolitan Police, United States Capitol Police, United States Secret Service, United States Park Police, United States Attorney's Office, DDOT, and DC SANE. As a result, an additional 720 cases were tested in fiscal year 23 for non-medical examiner purposes, to include driving under the influence, DUI, drug-facilitated sexual assault, and breath alcohol program. With this caseload, the lab exceeded key performance indicator to include 98% of toxicology examinations within 90 calendar days of case submission, exceeding the target of 80%, and 84% of toxicology examinations within 60 calendar days of case submission, exceeding the target of 50%. The agency forensic toxicologist, chemist, laboratory technician, and staff assistant are indeed committed to the quality, integrity, and success of the laboratory. Training and professional development. In addition to death investigation, the agency has an academic mission, which is filled through employee training and professional development opportunities. This is a mandatory and significant budgetary cost to the agency. In order to be in compliance with licensure and accreditation requirements, the agency provides in-house educational trainings and support for attendance at industry conferences. Additionally, internship for students interested in careers in forensic pathology, medical legal death investigation, anthropology, toxicology, and forensic sciences are available. The agency also provides training to non-employees and stakeholders to include medical school residents and students, interns in various disciplines, and forensic pathology fellows. During this third year of our forensic pathology fellowship, we're hosting 2 fellows. That means 2 pathologists that are going to have forensic pathology as their subspecialty. Fatality Review Unit and Committee Operations. As an important component of the district work towards improving the health and safety of specific resident populations, as well as reducing associated mortalities, the agency supports the district fatality review boards and committees to include child and infant fatality, developmentally disabled, maternal, opioid, and violence. The fatality review process is highly complex, labor-intensive, and requires extensive analysis of multi-system records, often over thousands of pages to review, for the purposes of identifying risk, protective factors on multiple levels, could be individual, family, community, environmental, institutional, etc., and the circumstances leading to the death. The reviews have also involved public members who engage several of the committees and 1 board for the purposes of furthering their educational research, learning more about the subject matter, and attempting to identify ways in which to further support the work of the committees and the 1 board. The fatality review specialists and staff assistants have worked diligently and have exceeded expectations in the quality of fatality reviews, provided with particular emphasis on obtaining the necessary records to enable the committee, board members to make intentional findings, recommendations, system connections, and additional opportunities for resource sharing. This information is then provided to stakeholders and the general public via annual reports. The agency will continue to refine our process and engage stakeholders in additional ways to make the information contained in the committees and boards annual report as user-friendly and subject matter specific as possible. Finally, other key fiscal year 23 agency initiative worth mentioning include a continuing focus on emergency response and fatality management, the analysis and provision to stakeholders of mortality data through our Data Fusion Center, a focus on employee health and wellness via vicarious trauma training, and the renovation of our space within the Consolidated Forensic Laboratory. The agency mission-critical work I have discussed today is supported by an administrative unit staffed by executive management, legal counsel, human resources, procurement, records management, and quality, information technology, administrative, and epidemiology data fusion staff. These employees, and all named throughout my presentation, are committed to excellence in implementing the mission of the agency with compassion to the next of kin and friends of those deceased. The work is challenging, and our employees require support. As such, I would like to thank the entire OCME team for their dedication and hard work. And I appreciate the administration and his council's commitment to providing resources necessary to create an environment wherein our employees may succeed. In closing, we continuously strive to be fully responsive to our families and improve the quality of our system. I would like to thank Mayor Bowser, City Administrator Donahue, Deputy Mayor for Public Safety Apia, for their continued support and guidance. Lastly, thank you, Chairperson Pinto, for your leadership and support. We appreciate the opportunity to share our accomplishments and plans for continuous improvement and look forward to working with the committee into the future. My team and I are happy to answer any questions you may have.
Wonderful. Thank you so much, Dr. Diaz, and you and your team have been busy. And I want to thank you and your entire team, those here today, and who aren't, who are doing this very important and taxing and intense work. And we're very, very appreciative for their service.
Thank you.
So I want to start on some of the autopsy times that you're focused on, and congratulations on really excellent performance numbers. You indicated in your pre-hearing questions that 89% of autopsies were completed within 90 days during FY23, which is, just right around the performance target generally aimed for. In other areas, such as response times to scenes and toxicology lab processes, the agency exceeded its performance targets. Albeit very slight, can you explain kind of what efforts the agency has undertaken to continue or improve performance targets in FY24?
Yes, it's a daily commitment. You are 100% correct in the sense that the busier we are, it is an equation of how can we accomplish that finalizing an autopsy report within 90 days. And I will put myself as an example. I have to put myself on the schedule on occasion because otherwise the work is relentless. It is worth of note that 90% completion or close to 90-day completion, it is a byproduct that the autopsy is the easy part, but you have to put together the postmortem toxicology, you have to put together the investigation, and finally reach a consensus as to the cause and manner of death. Even with an increasing case that I told you from 22 to 23, I can tell you the increase from 2017 when I came to the district to 2023 and 24. It is easily 60% increase in the number of cases. It's not unique to the District of Columbia. It is United States. Our field is inundated with what it's been called excess death. That's not only people centralize their attention in homicides, but it's also drug-related death, and also after the pandemic, a significant increase in natural death. So it's a three-pronged factor that has increased caseloads across medical examiner and coroner's offices in the United States.
Okay, thank you for that context. And in handling an increased number of autopsies, are there any trends or kind of differences in the analysis that you're finding that we should be aware of?
Yes, one area of concern, and we produce a monthly drug-related death report, which we call opioid report. And to put it in the context, I had it in front of me. 2014, the district had 83 drug-related deaths. 2022, 461. 2023 is the same number. So that's a 600% increase. You can compare and contrast with other jurisdictions in the United States, and it's the same trend. But those are drug-related deaths. To your question specifically, what concerns me, separate and apart from drug-related death and homicides, is the natural death. There is a significant increase. I'm not a treating physician, but we know why and how people died. And in my opinion, that is because a lot of people are not seeking out healthcare, maybe because they have concerns. I don't want to go to a healthcare facility and get contaminated by COVID or influenza and so on and so forth. But there is a significant increase, especially people with pre-existing conditions that are relatively young, in their 50s, early 60s, that are dying at home, having cardiovascular issues, having complications of diabetes. They died at home, ergo they become the jurisdiction of the medical examiner. As I said, it's not a unique issue in the district. It is nationwide, and that's something that will need to be addressed locally and nationally.
Okay, thank you. So with the recognition and understanding that this is very difficult and demanding work, I'm concerned about the caseloads of everybody on your team, including your own. In pre-hearing responses, you mentioned that for 2023, there were 1,709 case examinations, 1,288 autopsies, and 421 external examinations. But with only 4 full-time medical examiners at work, each examiner had over 250 case examinations per year. How are we working to fill these positions? I know you talked about kind of it being a national issue, and other factors that are facing this, but what steps are you taking to fill those roles, and how can we be most supportive as you do so?
Yes, thank you for that question. And we were intentional in creating a forensic pathology training program in the District of Columbia. It didn't have. In my case, I trained at the Office of the Medical Examiner in Philadelphia, Pennsylvania, 25, 27 years ago. The district never had one. So creating a training program for pathologists that want to become forensic pathologists is one step, because you are indeed training people that may end up working in your agency. That is the case. The first fellow we train remain with us. And that's one step. The other step is also to heavily recruit people that want to work in the district. And that's why also we have been intentional about having OCME as a premier medical legal death investigation agency where people want to work. Hence, that's why we pursue the accreditation by name, the accreditation by ANAB, being one of 4 offices with such accreditation. It is, I will not lie to you, it is a difficult task because that human resource, forensic pathology, is scarce, and there is a lot of competition to get people. However, I'm confident that we're going to be successful in hiring at least 2 more medical examiners to share that load of work. I don't foresee in the United States that there's going to be a decrease in the number of cases. And one thing that is worth of note, and I'm sorry I'm taking a long time to answer the question, that is worth of note is a lot of jurisdiction has taken a resource utilization approach. In other words, jurisdiction may decide we're not going to do drug-related death. So if somebody has a syringe on their arm, why are we going to do examination, testing, and so on? I think that is erroneous because then you don't have the answers of why the person died, how the person died, what are the trends in your community. However, to your point, at some point, decisions has to be made because something is going to give in terms of medical legal death investigation, specifically autopsies. Can pathologists handle 500 autopsies a year? Then you're not accredited. So it is a It is a difficult endeavor, but it's not impossible. And in my opinion, comparing and contrasting with a lot of the jurisdiction in the United States, I think DC is performing um, tasks and providing information that other jurisdictions, because they don't have the financial resources, are not.
Thank you for that added context. And in thinking kind of outside the box of getting more folks in the pipeline, I was very interested by your testimony and talking about some of the internships and fellowships that you all are offering, um, particularly for forensic pathology, investigation, anthropology, toxicology, and forensic science. Can you tell me a little bit more about what kind of outreach OCME is engaged in to entice students and other young people to join this profession, especially given the national shortage? I know my own cousin's daughter, who is about 20, was telling me she was interested in this field, and she initially thought she wanted to be a nurse, but then realized that she could help people from a different part of the timeline, still with this medical focus. And so I think it's great that you're engaged in this effort and curious more about how you're thinking about it.
Yes, and that is a commitment by every and single employee. Because if you have a job to do, and then on top of that, you have to be mentoring, it's a lot to ask. But we have imparted a philosophy, not of my own making, but my predecessors in the district, of mentoring on helping students find their way. And the best way, if you're interested in forensics, is at least getting acquainted with it. Is this for me? Can I do this day in and day out for the next 40 years? Uh, because forensics in general has a negative feedback connotation. As a physician, I can tell you, uh, I went to a medical school reunion back home, and some of my colleagues were getting patients in the restaurant where we were that recognized them and were very happy to see them. Forensic pathologists don't get that. Forensic scientists do not get that. So part of the sparking the interest is letting the students know what is forensic pathology, what is forensic investigation, what is forensic photography, what it entails to be every single day dealing with it. And majority of the people have the right attitude to go towards. The example you gave, can I help people? Uh, and you certainly can help people in the abstract by helping the family and by helping the community at large. The measure of a society is how they treat their dead.
Thank you very much. So I want to turn to some of the fatality review committees and boards. Um, and again, I want to thank all of the staff of our committees and boards for the immensely important and difficult work that you do. And it's extremely valuable to us in the district. Some of the review boards are focused on mortality, maternal mortality, infant mortality, opioid deaths, um, violence fatality. How does OCME understand its mission and statutory authority in its work to review mortalities and fatalities?
I think before I give the floor to Ms. Jenna, who is our manager, that's something that we are very proud. The federally mandated fatality review is the infant. Each county in the United States has to have one. We have 6 fatality reviews. And this is my 4th or 5th time testifying. And again, I implore patience. The work of the fatality review committees and board is extremely labor intensive, and the results will be seen through the years and how improved system processes. But as a medical examiner, there's no other one in the United States that has so many fatality reviews. It goes with the philosophy that the Office of the Medical Examiner we don't want to be mere processors of cases. If we have the knowledge of how and why people died, there is something that could be done to prevent, not the death, we're all going to die, but to prevent the death at a certain point that didn't need to happen at that point. And for that, the work of the fatality review committees and board is essential. And And I will let Ms. Jenna, who is the manager of that fantastic team of people, answer your questions.
You. Good morning. Yes, we have a fantastic team and the committee members and board members that share their expertise every month is the only way that we are able to do the work that we do. And the fatality review process has allowed for a more quality assurance opportunity for people to really see what the agency services and touch points have been for individuals who unfortunately have passed away, to see how we can prevent their deaths from occurring in the future and even improve systems or address barriers that are seen across the spectrum.
Thank you. Can you tell me a little bit more about the Data Fusion Center and how mortality data and analysis is provided to stakeholders?
Absolutely. The Data Fusion Center is an integral part. We have a full-time epidemiologist, and we have a staff of 4 people working solely for the purposes of gathering data on all fronts. And that's why we're able to produce different types of report that are requested by not only for our own purposes, but for our stakeholders as well. So, for example, in the opioid-related death, we have a lot of important data: who's dying, where they're dying, where they were found, and so on and so forth. And with that data, with the help of that data, for example, an opioid abatement committee was established by council. I believe Councilperson Henderson chairs that. And it is worth of note, for example, that the opioid epidemic in the district is very different than in the Midwest. Our population that is dying are the elderly African-American males. And to your point, that coupled with the fatality review committees, those people are touched by the healthcare system in the district, in the surrounding areas. And one of the goals will be for those health systems to communicate, because it's my understanding that they are not communicating. I'm going outside the realm of my expertise, but those are one of the little things that could be done to improve the follow-up of patients that one day are patients and the next day they are dead because of an adverse reaction to an opiate.
And what sort of trends are we seeing in the opioid fatalities, specifically with change in substance or change in reaction?
This is the main opiate use is fentanyl and fentanyl analogs. I believe that 99% of our drug-related death has opioid-related death has fentanyl in them. That is, Chairperson Pinto, that is the most difficult task in 2023, 2024, coming from an older person. In my time, there were 2 drugs, cocaine and heroin. Now, if you have some chemical knowledge, you can tinker with substances and create something that didn't exist before. And to chase that new substance, I think Dr. Tolliver can testify better than I can, but to chase for those substances is not as easy as it is portrayed on TV shows. So you need to know the eyes cannot see what the brain doesn't know. And instruments are exactly like that as well. So if I create a new substance in my garage, the instrument is going to give you a peak, but then you need a reference library to compare it and verify that that substance is there. And what has changed in the last few years in the United States is the constellation of substances that are found post-mortem. Years past, 2 substances. Nowadays, it's not uncommon that a drug-related death will have 6, 8, 10 different substances, going from fentanyl to cocaine to heroin and any other substance in between. It's not uncommon. That makes post-mortem toxicology difficult because we are dealing under a disadvantage. First, blood doesn't circulate on the dead. People start decomposing fast. And to do those analysis is not easy. And then you will have to be, I'm using a vulgar term, you have to be chasing substances that they are there, but you don't know what they are until you find a reference that tells you this is a new substance created by somebody. And every single week, those reference libraries need to be updated. It's not only labor intensive, it is expensive.
Wow, that's very concerning. And as you point out, touches so many different areas that we need to be doing better as a city and reaching people earlier. What about trends that we're seeing with violent fatalities?
Yes, there's been an increase in homicides that, it's been pointed out. When I came to work in the district in 2017, there were 115 homicides. And I think we all know the numbers of the last 2 years. And that increase in the number of homicides also take time when you're doing a postmortem examination on somebody that has been shot 20 times or 30 times as compared to a natural death. So the numbers are smaller than drug-related death, but by virtue of what they are, they require time. Also, there's been a slight increase in self-inflicted death. The district, and I published a peer review article, I think 4 years ago, the district was the lowest in suicides in the continental United States. I think we still are, but there's been an increase. And when you say an increase from 63 to 70, well, that's 10%. So you see those trends. In my opinion, there's an increase in every category of death that you measure.
Okay, but in terms of locations of the body or causes of death, or I'm thinking gunshot wounds in particular, are there differences in the ways that people are dying as opposed to just the numbers going up?
Yes, there is a significant difference. A few years ago, the typical victim of homicide in the district had 1 gunshot wound, 2 gunshot wounds. Now the average is 5 or more gunshot wounds. So that's a difference.
Okay. In terms of the opioid board recommendations, there was one recommendation to develop a 6th test box that's specifically made to capture the responses of the 6 questions still in progress. You mentioned in your pre-hearing responses that the case management system is being worked on with the agency's IT and a vendor to update this. I'm particularly interested about the recommendation to ask bystanders in the area what they knew or saw of the scene. What's the update there?
The update, we are about to go live with the new information system that will answer all those questions, and that will be within the next 30 to 45 calendar days. So we are going to be able to answer all those questions. Those are very important questions because that goes to the genesis or the root of the issue. The Department of Forensic Sciences, on a monthly basis, they issue a report that they call a syringe exchange program. In other words, they test paraphernalia of people that don't die. And that gives you a glimpse into what's coming. And that coupled with all those questions, I think we're going to be in a better position of what people are using, what could be the danger, are there new or novel substances introduced, and then we will have the knowledge, not OCME, but law enforcement and other agencies that work with people with addiction, what's out there on the street. What can we do as a city to try to prevent, try to alert those users that there are novel substances that we are seeing in real life. Now, when the person is dead, you are absolutely correct. Asking and answering those questions will be extremely important.
Okay, thank you. We look forward to seeing that implemented. As you know, Dr. Diaz, I introduced the Transgender and Gender Diverse Mortality and Fatality Review Committee Establishment Act last year, Bill 25-460. which I see as a really important first of its kind tool to inform future strategies and interventions that we need to see to drive down the disparate outcomes that we're seeing with our transgender and gender diverse residents across the district. I don't want to spend too much time getting into the details of that bill here, and we'll have a separate hearing on that soon. But the review committees and boards sometimes divide up their case and statistical reviews by themes of populations. Can you tell me more about the LGBTQ plus cluster review that the Opioid Fatality Review Board is currently undertaking? And is this a subcategory that we see across other review boards?
Yes, it will be a subcategory of every review board. Thus far, what we've seen in the LGBTQ plus community is drug-related death. Worth of note, they're significantly younger than the average population that we have seen in the last few years. I don't know if Ms. Jenna would like to expand.
Yes, so some of what came out of those reviews is that that population has endured barriers to services. So it's much more difficult to obtain housing. It's been difficult to obtain certain services, medical and what have you. So trying to find ways to have service providers change their engagement strategies on how they work with individuals of that population to make them feel more welcome, make them want to come and use your services to help further support them, especially for those with substance use disorders.
Okay. And are you, in terms of the other fatality review boards, other than opioids, is this a group that you're zooming in on to determine trends?
We are. I have directed all of my team to, when we can and individuals are known, for us to highlight those cases, to do a thorough review, to see what the circumstances were, what they endured, what services and touch points they had throughout the city, so that we can further try to identify what can be done. We've also invited the Director Bowles, from the mayor's office on LGBTQ plus to participate in that process, as well as some additional community members to participate in the reviews, to share their own experiences with the services and help the board create recommendations.
Thank you. In your pre-hearing responses, when asked what kind of training and ongoing education that death investigators received on trans, gender diverse, and gender expansive decedents, you replied that at present, there is no training and/or ongoing education on this topic. All decedents are scientifically identified in the same manner. So first, I want to recognize that, to my understanding, the case review intake forms for death investigators at OCME are pretty inclusive, consistent with the inclusive practices of jurisdictions like New York and Oregon, in that death investigators at OCME have options to select several different categories for gender, both cis and trans, in the intake form, and narrative boxes. But when it comes to in-house training, is that something that you're thinking about expanding, that you have plans to expand? And how do you track the continuing education of death investigators and training that they might receive on this topic?
Yes, we have a tracking system for all training. Your point is well taken. I think everybody in medical legal death investigation, similarly to any other healthcare worker, needs training on populations at risk, like the LGBTQ plus community. So since we have a tracker, it is a matter of finding the right training, because our main task is, number one, the identification, and number two, what circumstances led to the death. So having that sensitivity in looking for what are the trends and identifying, I think it is essential. It is, I think it's difficult in the medical legal death investigation community in the United States. I wouldn't say that there is resistance, but we in the district want to be at the forefront in terms of training, in terms of accurately not only determining cause of death and classifying the manner of death, but the circumstances into which the person found themselves when they died.
Thank you very much. So in your pre-hearing questions, the committee asked what the average time it takes for a case to be presented to a review board committee from the date of the decedent's death. And you offered a host of details on the complexities and barriers that the committee and boards face in getting access to records, noting that, quote, "It has been difficult to review cases within the mandated timeframes." I appreciate the detail that you offer in describing the time and all the complexity that it takes. Could you give an estimate of what the average time it takes for cases to be presented to a given review board? And are there any efforts underway to improve that, or any ways that the council or the committee could be helpful in your efforts there?
Yes, so it depends on the committee. However, for child and infant, we've been trending around 2 years for review. Also, because for child fatality review committee, because as Dr. Diaz said, there's been an increase of 60% of homicides. That means the committee also has to review those. So our caseloads have gone up. So we are presently reviewing around 3 years for child fatality review cases. For those cases that were a year of death of 2022 and above, the time frame is roughly around 1.5 years. For our maternal, we're trending around 3 years since the death. For opioid, around 18 to 24 months. Because we're able to do a lot of those in statistical fashion, so we're not doing full records for all 400 and some odd cases. And then for our violence fatality review, it's around 2 years. And that is because of the volume of cases, the volume of touch points that decedents have had. It doesn't make sense to not look at those touch points, because then you can't look at what may need to be improved if you don't know the systems that touch them. And unfortunately, there is not one database that houses all of these records and services together. So my team also acts as their own investigators. And once we get certain information, then we have to follow the trail for other touch points to make sure that we have all the relevant information to present to the committee.
And are there any risks of delay of analysis after 2 years has passed for a decedent? Or is it the autopsy component is done first and then the larger contextual pieces are done second?
It's as you described in
Okay.
the latter.
Okay, thank you. In terms of the infant and child fatality work, can you provide us an update on the infant and child fatality review boards? I know that the board plans to combine the 2021 and 2022 annual report for May 2024, and that the staff is currently working on the data for last year's annual report. When will the 2023 annual report be available?
2023 will be available next calendar year, because we will start working that in the next few months. We're trying to complete the prior reports. I myself, as a practitioner, am having to write some of that just to help out with the team. So it's a all hands on deck effort to complete it. The same staff who write all the case summaries and what have you are the same staff that are writing the annual reports as well. So my team is doing an excellent job, and we're very proud.
Okay. And the district has been engaged in a lot of work in the last several years to improve outcomes for infant mortality, additional preventative healthcare options, at-home visits. Have those interventions been borne out in the trends that you are seeing with infant fatality?
We have seen them, but a lot of it still has to do with engagement and access. And when I say access, it's not so much proximate location, but In addition to that, it's having specialty providers that are available to individuals who may need specialized services. It's those individuals to have appointments that are not just your standard 9 to 5 or 8 to 5, but can accommodate later hours or provide childcare options for those individuals who may have to bring their children along with them. So access is one thing, but those other components to get people into care, and then compassionate care in terms of how you engage people, asking them perhaps why are they seeking care today? So you eliminate that judgment and really get them in and make them feel welcome to the services you're providing. Because if you don't have that, you can provide as many, or say you're providing as many, but if people don't feel comfortable with coming to receive the services, then that's not what should be intended.
Thank you. Can you elaborate on the process for receiving death notifications from DC Health? Last year, I believe OCME received data quarterly, taking up to 5 months. Is that still the case? And how are you working with DC Health to receive more automated notifications?
So yes, that has been the case. We have since had meetings with the new registrar of vital records, who is working with us. So we are trying to have more frequent meetings with them to make sure. Our goal is to get the notifications on a monthly basis, and they are committed to working with us to try to get that information. So we're still working out the kinks and how that will portray, but there's certain systems where we are sharing data back and forth.
Okay. And, we've talked a little bit about the intense caseloads and heaviness of this work. What kind of investments has OCME put in place for staff and employee wellness? I believe there's vicarious trauma training, but it's my understanding that you all no longer provide grief education and services referrals to next of kin. What is your thinking around that, and what we can do to support your staff's well-being?
Yes, and I will defer to Ms. Fields, but I would like to say something as a person who's been in forensic pathology for 30 years. The trauma in the last 3 years is real, and that's something I never saw or sensed before. So in other words, when you chose this profession, this is the business you're in and deal with it. During the pandemic and after the pandemic, I think there's been a game changer in terms on how our staff interacts with our stakeholders. So in the sense that unfortunately people are on edge, so even responding to a scene may be difficult for not only law enforcement, but it's difficult for OCME personnel, the Department of Forensic Sciences, and the type of cases we're seeing also take a toll that I personally didn't see in years past. So it is that vicarious trauma training, it is essential because it, if not, we, the people that work in forensic pathology, forensic sciences, may start developing issues. And that will further obstruct the work we do if you are not mentally all there. And I will let Ms. Field answer that question.
The vicarious trauma training at the OCME really starts from the top down, from the management level. So you've heard from our chief, Dr. Diaz, and his take on vicarious trauma. So from there, we work with our managers such that they have a good understanding of vicarious trauma. So we have a managerial retreat where we train our managers about what vicarious trauma is. We have that retreat annually, and they have that training. So from there, making sure that our managers understand how to work with their staff and understand what their staff may be dealing with the type of work that they do. We then provide an annual day of wellness with our staff, wherein they have an opportunity to focus on themselves. We have that at Haynes Point. We do some training during the day, some emergency response training, some operational training. But then the rest of the day is their day where we do some exercising and yoga and cookout, et cetera, where we focus on that wellness. Throughout the year, we also provide the staff with several resources for vicarious trauma. So for example, every person on staff has received 4 to 5 books on how to deal with vicarious trauma. They've received journals, they've received pamphlets and little takeaways that they can refer to on how to deal with vicarious trauma. We are also looking to expanding that wellness day to a couple days a year, as opposed to just one day. So as opposed to just in the fall, perhaps spring and fall. So we're taking a look at that. That was our chief's idea. So the awareness, we believe, is the first step, and making sure that the employees know that we care. And I think that's a big part of it. I think one of the most recent activities that we did, was really a boost for morale for the staff is we had a Christmas or holiday, I should say, competition of decorating your area. And that was a big boost to morale and gave some relief to us staff. They really enjoyed that. So we try to think of some innovative ways to get their mind off of this type of work that they're doing. And so we'll continue at it and continue to take ideas from the staff and from managers to see how we can make sure that they are well.
And if I may add, one of the difficult things nowadays is not only forensic staff that is in shortage in the United States, it's also mental health professionals. How do you find mental health professionals, social workers that can help, like an agency like OCME? You may have an aspiration that that is the case, but the sad reality is not quite as available as you think it is. Even at an individual level, do you want some mental health counseling? It's not that easy. So that's a limiting step also that I think as a whole, like the district and a lot of jurisdictions need to think about because that's an issue.
Mhm. Thank you. Well, I think that is a good place for us to conclude. I really appreciate you being here again and your entire team, and for all of the hard work that you do in any ways that the committee and the council can be helpful as a partner to you and your work going forward. Please count on us.
Thank you very much.
I'd like
Thank
to
you.
invite you, Dr. Diaz, if you have any other final closing remarks that we didn't get to, please feel free.
No, for brevity's sake, I would like to thank again the 101 employees at OCME that makes the work worth it because they are fantastic people that work at the Office of the Chief Medical Examiner. They usually don't get recognized because of the work we do, but we have people committed working at OCME for decades. So I think they deserve all the accolades. And thank you for having us today.
Thank you very much, Dr. Diaz. Thank you all. We will now turn to the next agency we're discussing today, the Office of Unified Communications, otherwise referred to as OUC. OUC is responsible for providing fast, professional, and cost-effective response to emergency and non-emergency calls in the district. OUC was established in 2005 to combine the emergency 911, non-emergency, and 311 call activities from the Metropolitan Police Department, Fire and Emergency Medical Services, and customer service operations. I'm looking forward to speaking with Director McGaffin about ongoing efforts at OUC to hire and retain staff, ensure maximal transparency, and to improve 911 operations. there really is no room for mistakes when the stakes are this high. And so I'm glad to continue this conversation about how to improve 911 in the district. For today's hearing, we will hear from the public witnesses here first to discuss OUC, then our virtual public witnesses, and then our government witnesses. Public witnesses will have 3 minutes to present their testimony. I'd like to first invite our first panel of public witnesses to come up. I'll ask the first person to sit farthest to my right and your left, and then each seat afterwards. Janelle Pagetz, ANC Commissioner, ANC 3C03, and Sabrina Richardson, public witness. And it's just the two of you for in person, so if you want to sit one over from her, that's fine. It's up to you. Ms. Richardson? Okay, I don't see Commissioner Paget's here, so we will start with Sabrina Richardson, public witness. Please go ahead.
Good morning, Councilmember Pinto and council members watching today. I would like to thank you, Councilmember Pintos, for responding to my email first. My name is Sabrina Richardson, for those that don't know me. I have been a DC resident my entire life. Recently, I was forced to resign from OUC to leave what I loved after 25 years of making over 6 figures. My resignation was forced due to unfair labor practices, people dying, no retirement, being overworked, causing mistakes, and supervisors using bribery to gain a position. Just blatantly being treated inhumanely. And on today, my focus will be on these concerns. Number one, OUC is practicing unfair labor by allowing training divisions to harass, taunt, and degrade 911 call takers with tenure. The writing is on the wall. In the last 2 years, 2 senior call takers have been fired. 2 have resigned due to harassment and unfair labor practices, and many others are being taunted and harassed. Others are leaving the agency because of the unprofessionalism. I was a CTO, call taker, and a union representative. And with training new employees that are released to the floor, I noticed that they are always taught something totally different that those employees that do the job. And those tenure employees fall by the wayside, not even aware that training is setting them up for failure. So when they're forced to go back through remedial training, they fail and they're fired because they were not afforded the same training a newer employee or was taught as an adult learner. The goal is to rid the agency of tenure call takers that make 6 figures or close to that amount to bring in 3 or more new employees. My second concern is holdovers are killing employees literally. Crime is at an all-time high, as we all know. The call takers and dispatchers have the most stressful job in DC. During my tenure, I have dispatched, trained, and most of all, did the job as a call taker. There are only 24 hours in a day, and employees are being held over an extra 4 hours on a 12-hour shift and 8 hours on an 8-hour shift. Constantly. They are expected to be back on time with no expected delays, all because the agency hires an inexperienced director of operations that has no idea of what he's doing or what he's directing. He has caused the agency to lose several employees that would have stayed otherwise. My advice to the city is to stop hiring those people from these small town agencies and small agencies that ideas never work for DC and the operations of a nation's capital. Small minds have small ideas, and for this, OUC gets an F-. My third concern, last year I encountered a call I received from Charles County, Maryland. That call caused me to have PTSD. Our OUC shows statistics over saving a human life, and this was very unprofessional because we were advised not to hit an abandon button because it caused CAD to lose statistics. A DC citizen lost her life. She was someone's mother, and service was delayed due to a man-made error that still has not been corrected today. If someone calls from an agency outside of DC, call takers cannot put the call in unless they hit the abandon button. I was advised not to hit the abandon button, which caused a 17-minute delay in service and causing death to someone's mother. A supervisor stood over me, trying other options. However, none of them worked. The transferred caller got frustrated and disconnected. And me, caring about life over stats, I hit the abandon button as soon as she walked away, and I put the call through. Service was rendered, but it was too late. The female patient from Douglas Road Southeast was DOA. My resignation has been a relief because the blood is no longer on my hands. My fourth concern is supervisor staff uses bribery by giving employees time not worked and uses her religion beliefs to cover up her wrong. She needs to be investigated and removed because the agency allowed the supervisor the title of Supervisor of the Year. And with that, I say happy Thursday to all that have been harassed by this supervisor. Last, in closing, I want to say I loved my job. I delivered 12 babies over my 25 years, saved lives during 9/11, received the only call from the plane that crashed into the Pentagon. I saved the Pope on a visit to DC. I triaged hundreds of stabbing, shooting, and stroke patients that survived. Started CPR on hundreds of cardiac arrest patients that survived. Stopped a young man, a Black young man, from killing a white woman at Union Station, and later left my job to give him prayer and money for a hotel. The 911 operator is the first line of defense, the person that calmed the storm on the worst day of your life. This is a thankless job, the job with no closure, and Washington, D.C. still has not respected what we do. Because we still have no retirement. No retirement. Hopefully in the near future, my team and I will be able to fill the gaps needed at OUC with my agency, Public Safety Manpower, a public safety temp agency developed by retired dispatchers, call takers, police, fire, and ambulance personnel with over 572 combined years of experience. Thanks for the opportunity for my testimony today. And if you have any questions, I'm pleased to answer.
Thank you so much, Ms. Richardson, for being here today and for your 25 years of service to the district. Greatly appreciate it. I want to understand a bit more about the practice of abandon calls that you talked about in your testimony. What
Yes.
exactly is the protocol as it relates to calls coming in from other jurisdictions, and what are you advised, and why do you think that's a problem?
So when calls come in from another jurisdiction, the CAD system doesn't recognize anything you put in because it's not coming from DC. However, In the past, we would click the abandon button. That was stopped for statistical reasons.
And what happens when you click the abandon button?
Any information that was sent over to CAD erases. And so my concern is many citizens and visitors and stakeholders will die because they stand firm on not clicking the abandon button. There's a new system that they have, not sure if the abandon button is on that system because we had 1-day training on this new system that's not compatible to the computer system as well. So, and that's going to cause deaths as well. So they stand firm on not clicking the abandon button. And with that, I was unable to put, because my supervisor was standing over my shoulder and she said that she would get in trouble, which I know she would have, if I clicked that button. So I respected her enough to wait until she walked away and I clicked the button and put the call in, because that is the only way I would have gotten it through to dispatch. It is what it is. It's people are dying. People are gonna die. It's just so much
But
dealing with the situation at hand. After it happens, it's like the blood is on your hand. I could have written myself out of it, but it's just a lot with just sitting there, you know, with someone over your shoulder and they're saying they're going to get in trouble. I'm going to get written up, which I didn't care. That's why I clicked the abandon button.
Right. Okay.
However, it was too late. She was DOA when they got there. So yeah.
And Ms. Richardson, were you ever spoken to about possible termination before it happened, or put on any improvement plan, or had an opportunity to speak with any supervisor about it?
No, never. I went straight to the source. I went to Heather, the director, and I told her what happened. Normally with those types of calls, we get lashback from training. We'll get written up from training, or we'll get recommended remedial training. However, because it was the agency's fault that this lady died, everything was swept under the rug. Didn't hear anything about it. The situation never got corrected, and it's still not corrected today.
Well, thank you very much for your testimony, and
Oh, you're welcome.
we will discuss it when we get to government witnesses. Thank you very
Okay.
much for being here.
All right. Thank you so very much.
Thank you. All right. We have been joined by my Ward 5 colleague, Councilmember Zachary Parker. Councilmember Parker, if you have an opening statement you'd like to make, I'll invite you to do that at this time.
Thank you, Chair Pinto, for convening today's hearing and our public and government witnesses that are joining us. I'm here today to hear testimony and to follow up on grave concerns that I continue to have about the performance of OUC, an agency that plays a critical role in protecting district residents and dispatching emergency services, including fire, EMS, and police. As many folks are aware, OUC failures to the tragedy at District Dogs last summer in Ward 5, where many residents lost beloved pets in a flash flood, and the lives of several employees were put at risk. Despite receiving calls from several employees who accurately communicated an ongoing issue, OUC call takers failed to dispatch fire and EMS resources to the facility, wasting valuable minutes. I'm deeply concerned that the public has never been provided with the full account of what occurred. And even the performance oversight responses for this hearing, OUC continues to withhold information requested by me and this committee. And I am deeply concerned that the district dog's tragedy is not an aberration, but rather a part of a pattern of incidents where mistakes at OUC have undermined the district's emergency response. In addition, since I have engaged on this topic, one of the principal responses of the director and the executive has been to point to the implementation of a new call system, Powerphone, as the answer to many of OUC's performance issues over the last few years. I've heard serious concerns about the implementation of this technology, especially in terms of how it will impact fire and EMS dispatch. And I am worried that it will not prove to be the cure-all that the executive has claimed it to be. So today, I would like to hear on the record what specifically we hope to gain by spending significant resources and time on this technology, in part to that when we are back here in 6 to 12 months. And I am also disturbed by some of the testimony that we just heard around the treatment or the alleged treatment of OUC employees. And so with that, Chairperson Pinto, I look forward to engaging further and for this committee and the council to hold OUC accountable. Thank you.
Thank you very much, Councilmember Parker. We will now turn to our virtual panel of public witnesses. I'm going to call again Janelle Pagatz, Commissioner for ANC 3C03, in case you've joined us online. Nathan Harrington, Debbie Knox, Kathy Henderson, and Dave Statter. Right, Nathan Harrington, Executive Director of the Ward 8 Woods Conservancy. Please go ahead when you're ready.
Oh, thank you, council members Pinto and Parker. I have to just first offer my acknowledgement and love and support for Sabrina Richardson. We know each other. Once I called years ago, I called 911 and she took my call, and I'm just devastated to hear what you've been through, and I really hope that this council can seriously find some solutions. What I'm going to be talking about seems kind of trivial by comparison, but I'm going to go ahead because, you know, as tax-paying Washingtonians, we deserve more than just emergency services. We deserve all services, and not just the ones that will keep us alive, but also the ones that will allow us to have a clean and healthy environment and to be healthy. So I'm going to be talking about the 311 system. My organization works to improve the health, beauty, and the public enjoyment of urban forests east of the river. And a huge part of what we do is combating illegal dumping. And that is a DPW responsibility that the requests are submitted for illegal dumping and sanitation enforcement through the 311 system, which is part of Unified Communications. And overall, it's a good system. You know, the idea behind it is that you don't have to be a local government nerd who knows exactly which agencies are responsible for which functions. You can go to 311, tell them what the problem is, and then that system will assign your request to the appropriate agency to be handled. But there are a few things that make it not always work the way it's supposed to. One is the fact that the whole system is based on addresses. So the first thing they ask you the first page when you open up the app or when you call the dispatcher says, what's the address? And sometimes you're trying to report a problem that is in the middle of the park. It's alongside a highway. It is not near any building. And providing a building address is just going to lead the responding staff person to the wrong place. For example, in the last 6 months, there's been a ton of tire dumping along 295. And it's a highway. There is no address. You can drop a pin on a map within the 311 app, but it will, even if you drop it alongside the highway, it will default to the nearest building that has an address, which in that case is on Fairlawn Avenue. So then the sanitation inspector will go to a house on Fairlawn Avenue and they won't see anything because the problem that you're trying to report is separated from that address by railroad tracks, a fence, a guardrail, etc. So I'm gonna highlight that and a few other problems, and then at the end I'll say what I think the fixes are. Another issue with 311, some of the forms ask the same question over and over again. For illegal dumping, for example, they ask for your phone number 3 times. It's as if whoever created the form just wasn't paying attention, or they didn't check their work because they ask the same questions multiple times. They ask, do you witness the dumping? Yes or no. And then there's about 4 other questions that are relevant only if you did witness it. Very rarely do I witness it. Usually I'm reporting dumping simply because I want it cleaned up. And so an intelligently designed form would eliminate those questions that are not relevant if you're depending on your answer to an earlier question. These are basic things that I've done in forms that I've created, using Google Forms, but for some reason, they didn't think of it, or they didn't bother to make these forms efficient when they were being designed. As I said at the beginning, the idea of 311 is one-stop shopping. No matter which agency your complaint belongs to, the 311 system will direct it accordingly. But sometimes that breaks down. They will respond and say, "Oh, it was sent to DPW, but actually it's DC Housing Authority. So here's their phone number. Call them." That's not the way it's supposed to go. The 311 system should be able to forward the request to the appropriate agency. They should never be sending you outside of the system. Unless it's, maybe if it's on federal land, I don't know, it may not be possible to integrate federal agencies into this. And another problem that I talked about at the DPW oversight hearing yesterday is that requests will be closed before they are resolved. It's not that nothing was done, but in the case of illegal dumping, they will first send out a sanitation inspector from the sweep division of DPW. They will look at it, and then they'll go back into the app and they'll message me as the person who submitted it to say, we've visited the site. We've determined that street cleaning is necessary. We forward it to SCAD, which is the street and alley cleaning division of DPW, and the request has been closed. So we know that they know about it. We know that somebody's supposed to be coming to get it, but I'm notified at that point, but I'm not notified when it's actually done. The only way for me to know if it's actually been done is to go a few days later and a few days after that and keep checking until I confirm that it's done. Usually it is done, but in some cases they say because there's a problem with the address or the location, they don't get it. And at that point, I have to start over and submit a new request because there's no way. The 311 system is one way. The resident initiates the request, but the city agencies give updates, but they don't. There's no way for the resident to provide updates back to them, and that I don't understand why that is. I'm not asking them to give out personal contact information for these staff people. It should be possible to message them through the app. And so simple solutions, ways that the app can be tweaked. There's already a map integrated with it. Just allow you to drop a pin that shows the location of the issue without having it default to the nearest address. The responding staff member should be able to see the pin and go to that location. They need to revise some of the forms so that you don't have redundant questions. Agencies that are not plugged into the system need to be integrated so that the request can be forwarded to the appropriate agency without the resident being directed outside of the 311 system. The system needs to be updated so that they can offer multiple updates at various stages of the process without closing it and then leaving the resident in the dark as to what the final resolution was. And related to that, there needs to be a way for the resident to submit follow-up information that would be added to the original request and having to start over with a new request. I've heard that, I know that the
Harrington?
vendor, yeah.
Mr. Harrington, you're a bit over time. I'm going to ask you to
Oh, okay.
summarize and wrap up, please.
Yeah. The vendor is that created this app is Salesforce, and a senior leader at Department of the Environment told me that they charged the district $100,000 for every update to the app. So what I'm proposing are basic fixes that, if that's true, would cost more like $500,000 just to make those 5 changes. which is crazy. So I haven't been able to confirm that that's actually the case, but if so, we need to seriously consider rebidding this contract to one that's going to fit our needs. Thank you.
Well, thank you. Thank you very much, Mr. Harrington. Your sound actually just cut off. It looks like you're not on mute, but I'm going to move on to the next witness. I appreciate your testimony. And just so you know, it's a not as discussed component of Secure DC that the council voted unanimously on Tuesday to advance includes updates to the 311 system, including drop downs for NPS land and other more granular services that people need through 311 to make things more user friendly and easy for folks. So you will
Excellent.
see that reflected soon. Thank you.
Good
Next,
work.
we will turn to Debbie Knox, president of NAGE R307.
Good morning. Members of the Committee on Judiciary and Public Safety, my name is Debbie Knox, and I'm the president of NAGE Local R307. I'm here today to testify regarding the current working conditions of my members at the Office of Unified Communications, OUC, which relates to the performance of the OUC. I represent the men and women who provide a service to ensure their role and responsibilities in public safety cluster is fulfilled. These men and women apply for various positions, stating ultimately that I will perform to the best of my ability what I have signed up to do in order to provide the service the citizens of the District of Columbia deserve. However, over the years and recent months, what we have seen and experienced is a lack of commitment and integrity when it comes to providing us, labor, with the full dynamics of what is needed to perform by OUC management team. The information in social media outlets, the news outlets, whatever outlets are being utilized to paint this negative picture of my members, it's not on us. The weight which we have carried for the past several years on our shoulders does not belong to us. My members cannot do what they have signed up to do if there is no consistency and daily reinforcement received from OUC management. If it's broken, the blame of what is broken is not on us. It's in those same managerial positions that may or may not be occupied by the same individuals to lead and guide us who should carry the blame. Just recently, radio channels were patched, combined, which jeopardized the safety and well-being of the field providers. It placed a dispatcher in an unnecessary position to continuously make the field units aware that they were combined with another radio channel. This action, which is done often, too often, is a disaster waiting to happen. A member sent an email request to the 911 operations chief to provide the policy as it relates to patching radio zones. My member's still waiting for a response. What is being noticed is there are resources available, but not being used appropriately to alleviate the patch combining of radio channels. I have stated this during my past hearings that the managers need to change. The actions being done is the recycling of the same mind concept with no true change. Until you change the people or change the people, the citizens of the District of Columbia will receive the same service, which from your position as representatives of the people is one of the primary concerns with public safety. They want change. Recently, OUC promoted 5 new managers. Of those managers, one does not possess the skill set to answer 911 phone or have the ability to dispatch a FIMS or PD call. So if this person has no knowledge of those skills, how can they manage and lead us? The only one thing we can state as a fact is all managers on the 911 team, with the exception of the one I have pointed out already, has only one skill set when it comes to 911. They are either proficient in the FIMS and or MPD as it relates to dispatching. A couple may be able to answer the phones. Promote, please, by all means, keep upward mobility in place, but stop setting these people up for failure. The perception of labor is the OUC is continually promoting, but not utilizing their resources effectively. Yes, staffing is an issue. It is and has been for 911 throughout the industry. In addition to staffing concerns, Isn't it management's responsibility for utilizing the manpower they have, inclusive of all 911 operations employees, effective and efficiently? In addition to, we have managers on the operations floor that consist of 911 and 311 employees who have been told not to come to the union. So not only are they not leading and managing, but they also interfering with my members' ability to exercise their rights as persons who belong to a union. Why would OUC manager interfere with their rights? As far as NAGE R307 representatives and the OUC, we are currently moving forward to resume the labor management partnership by initiating training, which is scheduled for March 2024. We're not engaged in any contract negotiations. We are engaged in bargaining over the 911 shift schedule due to an action taken by the OUC 911 Chief of Operations, which violated the rights of the call takers and dispatchers. It had to be stopped in order to ensure rights are protected. In closing, there's much I can share with you today. However, there is not enough time to ensure we cover all areas of concern. But I will leave you with this. 2 tenured members just separated from the OUC, as well as a member who had just completed their probationary period. Why would they leave? These members are just a few who have left because of how the OUC is not being managed and for the past 1.5 years and beyond. I foresee many more departing. I beseech you and your colleagues to meet with NAGE R307 representatives to see another side. Looking at only one side will not give you a complete view of what truly is going on. My members are exhausted for many reasons. We deserve more. And right now, everyone who has a role in how the OUC functions has failed us. Don't allow us to be the first or last time you engage with labor organization of the first responders, city service providers, and the technology providers of the District of Columbia Public Safety Cluster. My contact information is within the Director of OUC's response. Thank you for your time.
Thank you very much, President Knox.
You're welcome. I'm sorry. I thought I had my I had the slide. I thought it was on.
No, no
Sorry about
problem.
that.
I was wondering, but we could hear you clearly. So
Okay,
all good.
great.
Thank you. Kathy Henderson, ANC Commissioner, ANC 5D06. All right. It looks like you are up, Mr. Statter. Dave Statter from Statter 911 Communications. Please go ahead.
Hi, how are you today? Watching OUC closely for the last 4 years, I've come to some conclusions. Instead of just saving lives, DC 911 is a service that too often becomes a threat to the lives of anyone calling 911. It has become this way due to the Bowser administration's neglect. And that negligence is often topped with a slice of cruelty for the victims and the families. In 2021, Mayor Bowser ignored a dire warning about staffing from OUC Interim Director Cleo Sabito. This set the stage, so anyone who calls 911 now is likely to get a recording instead of a live person. We'll never know how many cardiac arrest or shooting victims have died because of the delays caused by the Bowser administration's neglect. One of those victims may have been Bernard Barker Jr. He collapsed on April 30th last year around 3:30 a.m. In the council's oversight questionnaire, OUC is asked how many call takers were working and under headset when Baker's family called 911 and heard the dreaded recording. Here's OUC's one-sentence answer, quote, "Information about this incident is not available for release to the public at this time." 9 months after Mr. Baker's death, OUC still can't tell the truth. Staffing levels on a specific date and time shouldn't be top secret. It's basic, factual information that the public, the press, the council, and especially Mr. Baker's family should be able to promptly receive. Heather McGathan's OUC is full of excuses, just like that heartless response about the Baker family's ordeal. Director McGathan raised her right hand in front of this committee a year ago. She promised accountability and transparency. She did that when trying to get your votes for confirmation. Once she got your votes, McGaffin has ignored that promise. She dutifully follows orders from above to hide the truth. And the stonewalling goes beyond Mr. Baker's death. The families who lost beloved pets at District Dogs still haven't received straight answers. Your questionnaire asked, where's the final report? Director McGaffin wrote a 3-paragraph reply, but in that reply, she never answered the question. In the last hearing, she also denied Councilmember Parker's request for the computer printout from that flood. She claimed an investigation was underway, but she wouldn't tell you who was doing the investigation. So I published that printout. It shows exactly why McGaffin is holding on to it for dear life. It's because it disproves the public statements about District Dogs made by McGaffin, the city administrator, and Mayor Bowser. They continue to cruelly deceive the people still hurting after their dogs drowned. Even when there's an official final report, OUC won't give you straight answers. 10 days before Mr. Baker's death, OUC sent fire, EMS, and police to the wrong bridge after a car plunged into the Anacostia River. 3 people died. When asked if this was an OUC mistake, McGaffin said, wait for the report. We're still waiting. Only the executive summary of that report was finally released. It fails to explain what the 911 caller said or what the location determining technology showed. That summary is useless. Director McGaffin also failed to give the committee straight answers about a current life-threatening OUC problem just mentioned by Ms. Knox. I'm referring to the dangerous chronic mistakes by dispatchers trying to deal with the patching of radio channels that leaves those channels abandoned for minutes at a time. Saturday night, the EMS channel for Northeast and Southeast wasn't answered for at least 7 minutes. I've been reporting on this specific problem for exactly 4 years. In 2021, Interim Director Sabito testified that to prevent this problem, she barred dispatchers from using portable radios and from patching those radio channels together so that a single dispatcher can cover 2 channels at the same time. That solution worked. But as soon as Sabito was moved out of OUC and then fired, the problem started occurring again. And those practices that Sabito banned are now allowed. That's because to deal with the stamping crisis, there are times Director McGaffin needs one dispatcher to cover multiple radio channels. Did Director McGaffin clearly explain that in her responses? Of course not. The most transparency just came from Ms. Knox about this issue. It's the most transparency since Ms. Sabito left. The council should be outraged by OUC's efforts to hide mistakes. You should be outraged that they mock the concept of transparency and accountability. You should be outraged that the Bakers and the families of those who died in the Anacostia can't get straight answers, just as 2 previous witnesses before this committee, Ms. Billy Shepard and Ms. Aja Griffin, couldn't get straight answers when their loved ones died. The council needs to start taking real action to fix DC 911 before others die needlessly. The status quo of neglect, cover-ups, and cruelty must change. Thank you.
Thank you very much, Mr. Statter. I do have a couple of questions and then I'll turn to you, Councilmember Parker. So President Knox, thank you for sharing some of your concerns about workplace issues. What do you think is needed immediately at OUC to better retain and hire staff?
Oh, gosh. I believe right now, as it relates to 911, that, as I stated, the resources that they have, to better utilize the resources that they have. For example, they just promoted 5 supervisors. They're all police. Police is at a deficit even before they were promoted. But from what I'm seeing and what I've been told, even though management stated that they would be used to assist, they're only being able to use on the shift that they work. If there's another shift that needs help, I've only seen like 1 or 2 come in to help out. So therefore, utilizing your resources more effectively to assist those who are on the front line as call takers and dispatchers, to relieve some of that heavy load during this staffing issue would be one area to begin. And then even using the operations managers. I mean, they are both well-versed and have their skill set that they've started out out answering calls and police dispatching. They can come and help. And even the chief of 911, if they have to pull the supervisors from that top console where they're sitting and he answer the calls and they go down and help answer phone calls and dispatch, then that's what's needed. I believe that they need to be more effective and more efficient as far as utilizing the resources they have, especially even so with FIMS. You know, I know they have 3 FIMS supervisors. They may, like I said, assist during their shift, but they also need to assist the other shifts when needed. Sometimes as a manager, much is given, much is required. You may have to come in on a time that you're not scheduled to work, you know, whether you volunteer, you know, or not. You may have to come in and just help out, you know, until an agency gets to the place that it needs to be in regards to the staffing. It's not just staffing by itself. It's how you manage with what you have. You got to do better with it.
Is there an example of good management that you've seen that you'd like to see more of?
I see one manager that has a good rapport with a lot of the front line. And the reason why I say that is because what this manager can do is get call takers and dispatchers from both sides to come in and work, even if something suddenly occurs to where someone has to leave for whatever reason. This manager I've seen get on their phone and call to see if they can get someone. And oftentimes they're able to get someone in. And then I also have seen this manager listen, you know, to their people that they supervise, you know, and try to come to some type of resolution, you know, as far as what is or what isn't, you know, but being able to get resources in when a sudden change occurs or a sudden emergency, I commend this person for being able to do that.
Thank you very much. Mr. Statter, can you explain in layman's terms what patching is?
I can, but I think Ms. Knox could probably do a better job. But essentially, you normally, when you have a dispatcher, they're covering one channel. When there's a shortage, they will cover 2 channels at times. I've heard it particularly in the overnight hours where the channel 1 dispatcher is also covering an EMS channel, or the channel 2 dispatcher on the fire side is covering an EMS channel. And what happens is they have to punch both of those up. I don't know the physical ramifications of that because it's been a long time since I've done it, and it's much more advanced than when I did it a half a century ago. But it's a physical process that they have to do, and it's not working for some reason, and hasn't worked in 4 years properly. And because of it, when they think they're covering 2 channels, they're not. And apparently the procedures have been changed of late, but I'm probably not the person to give you the technical answer.
Okay, thank you. And as we think about transparency, and there have been a lot of steps that we have required with this dashboard and the clear need for additional transparency around the investigations and the result of the investigations, where do you think the balance should be in providing more information to the public while still ensuring that OUC kind of daily operations can be maintained?
I don't see how providing the information impacts daily operations. We can't get any 911 calls. You can't even get a CAD report. That makes no sense. These documents are public documents in a sense. They can be redacted for private information, but they're not. And that's what needs to be changed. The information on the data dashboard, the call, you have not been given what you asked for. You have asked for, how long does it take to dispatch a call? You haven't been seeing that because they leave out the queue to dispatch portion. That's a significant portion. So the public doesn't know how long it really takes every month or every week when they put those stats up. They don't know because it's not being provided, even though you asked for it.
Right. Okay. Well, thank you so much. And I should note another piece of Secure DC that we move forward on Tuesday does require the queue to dispatch time to be included on the dashboard to make that crystal clear for public awareness and transparency, but also so that we can back into other interventions to see improvements. And that information is key to that effort. Thank you all very much. I'm going to turn to my colleague, Councilmember Zachary Parker, for a 5-minute round.
Thank you. Mr. Harrington, I appreciate your testimony. I plan to ask the directors several questions related to your concerns with 311. You were pretty clear, so I don't have any follow-up questions for you. But Ms. Knox, I did want to probe with your take on managers being the problem at OUC. You mentioned that there seems to be a promotional or pipeline issue. How many of your members matriculate into the managerial role? Do you have that data?
I don't have the data, but like I said, just recently 5 did from the police side alone. I mean, if I sit down and I go through my records, I can provide the information, but who better to give it to you than the OUC? And if you want to confer with me to see if our information is does mirror one another, then we can do that. But there has been a great deal of my members who have matriculated to the management role, which I stated, promote, but please do not set them up for failure by not giving them all the resources, and then also basically encompassing them so that that even though you may have initiated training, that the training is working. Understand this. My observation is that if the front line is not performing the way that you see that they should be performing, then you look at those who have charge over them to give them what they need in order to perform. You can't look at them because they're only using and doing what they've been trained and using the resources that they've been provided. So it all encompasses one another as far as the managers being effective and efficient and consistent with the way that they manage so that the District of Columbia residents can receive the services that they so desire. I've been around a long time. I started under MPD. I've never seen this before when I worked under MPD, not to this magnitude. I haven't seen it. I'm sorry. So, to see this now, I have a comparison. I can compare to where we are today and where we were yesterday when I first started. So it's different.
To be clear, when you say I have not seen this, what is this?
We're always in the media. It's always about somebody making a mistake. We were the cream of the crop. We were the ones that other agencies came to, and they may still do it today, but the other agencies came to in order to see how it is to be done, how it was supposed to be done. And like I said, I'm not privy to that, but I am privy to the ones that I sit alongside. I'm not just the president of the union. I sit in that seat and I dispatch as well. And I see the disconnect, even with the radio zone that was patch meaning combined. There was 2 channels that were combined, and the field units kept trying to buy the airtime for the dispatcher, but at the same time, they're saying to the dispatcher, you're on the wrong channel. Why? Because they're not familiar with being on a combined zone. And when I heard that these zones were combined, that was my concern. These officers and these field providers that are out there, they've never worked a combined zone. So they don't know what the etiquette is. When I came in, we did do combined zone, unfortunately, but it was as such that both districts knew that, okay, we're combined. We can't all just charge in, and understand also that the radio allows you to bonk somebody out. So you're right. If you get in first, you're able to transmit. But back then it wasn't like that. It was radio courtesy as they
Understood.
Yeah.
I see my clock ticking.
I'm sorry.
I just want to quickly follow up. You mentioned there's a training upcoming in March of 2024. What is that training about?
Okay, the training is about the labor management partnership, having both sides understand what it means to have a labor management partnership and go into different areas as far as saying, but we've already basically discussed the different areas as far as us establishing a labor management partnership and what we do.
And then quick follow-up, what is your view or the view of your members related to the transition to power phone?
Oh my God, I received so many concerns. about the Power Phone application from my members. One particularly, a call taker said to me, Ms. Knox, say I get a call and the citizen says, I've been robbed, and I'm interviewing the citizen and I put in robbery because there's a box where you put in robbery. Well, you're going on through the questions and you have robbery, but as you're interviewing the citizen, you learn that it's not a robbery, it's actually a theft. But the robbery, which is a higher priority because depending on the type of robbery, has already gone to the zone based upon what was explained to me. And so because it's already gone to the zone, the call taker has said to me, they don't have a way where they can change that event type, that classification to say, no, it's not a robbery, it is a theft. So that was just one example that was given to me by one of my call takers.
But you would generally characterize the sentiment of your members as concerned with the transition.
Of course, yes, I am concerned because I do not feel as if their voice is being heard. And when I saw in the response from the director that they had a working group, I'm really interested in knowing who is on the working group from my membership who is participating with the Power Phone implementation.
Okay. I am over time, Mr. Stouter. I didn't get to you, but I appreciate your testimony and your continued advocacy and plan to follow up on some of the issues you elevated as well. Thank you all.
Thank you.
Thank you, Councilmember Parker. Thank you very much to all of our public witnesses today. Really appreciate your perspective and your testimony. We are now going to call our government witness, Heather McGaffin, the Director of the Office of Unified Communications. Please come join the table, sit wherever you're comfortable. Hi. And if you have members of your team who will be answering questions, if they can share their name and title for the record as well. Go ahead and make sure your microphone's on red when you're speaking.
Okay. This is my first in person. Thank you.
Oh, great. Well, welcome.
Hi, good morning. My name is Heather McGaffin, and I'm the Director of the Office of Unified Communications.
My name is Kelly Brown, and sorry about that. My name is Kelly Brown, and I'm the Deputy Director.
Good afternoon. My name is Marcellus Walker. I'm the Chief of 311 Operations.
Good afternoon. My name is Isaac Insomensa. I'm the Chief of 911 Operations.
Great. Thank you all very much. And as you know, it is the tradition of this committee to swear in all government witnesses who appear before it. So if I can ask you all to turn your microphones on and raise your right hand. Do you swear or affirm under penalty of law that the testimony you're about to provide before the Council of the District of Columbia and this committee is the truth, the whole truth, and nothing but the truth?
I do.
Yes, I do.
Thank you all very much. I'd now like to invite Director McGaffin to make any opening statement you may have.
Thank you, Councilmember Pinto and Councilmember Parker. I'm sorry, Chairperson Pinto and Councilmember Parker. Staff, guests, and the viewing public. As I stated, my name is Heather McGaffin, and I'm the Director of the Office of Unified Communications. I appreciate this opportunity to come before you to discuss OUC's fiscal year 23 performance. I'd like to begin by first recognizing the nearly 400 employees of the OUC. As an industry subject matter expert with experience across the emergency communications ecosystem, from call taking and dispatching to being a field responder, I could not be more excited about leading this team and what we have been able to accomplish in fiscal year 23, and I know that we will accomplish in coming years. OUC is comprised of dedicated professionals charged with answering the call on 311, 911, or in a support role for the two most used numbers in the District of Columbia. In June of 23, a leading health insurance company, Assurance, shared the findings of analysis conducted of national 911 data. This data showed that district handles more 911 calls per 1,000 residents than any other state in the nation, and that district residents overwhelmingly rely on cellular devices to call 911. As a result, the District of Columbia tops the list of states that utilize 911 services with about 1,115 wireless calls to 911 per 1,000 residents annually. The district's 911 call center is one of the busiest in the country, historically ranking as the fourth busiest behind those of New York, Chicago, and Los Angeles. In FY23, OUC handled almost 1.8 million 911 calls for service and created just over 1 million dispatch events. The agency also took 1.47 million 311 calls and processed 440,000 city service requests. Simply put, OUC answers the call. In this mighty effort, OUC continues to focus on the mission to provide the most efficient responses to emergency and non-emergency calls for service. As I look back on the past year, I'm grateful to have this opportunity to share that there's much to be proud of related to our performance and accomplishments, and I will highlight a few. During fiscal year 23, all 911 operations personnel were certified in telecommunicator CPR, or TCPR, and achieved 89% accuracy in identifying the need for TCPR, starting CPR timely, and giving exact CPR instructions on 911 calls. This certification helps to ensure the workforce is prepared to provide high-quality CPR instruction on every call when needed. The successful deployment of TCPR allowed numerous bystanders to start the process of saving lives until EMS arrived. Next, OUC successfully revamped the critical vacancy recruitment program, shortening the recruitment and onboarding process timeline by 50% and thereby reducing 911 call taker vacancies by over 80%. This achievement directly correlates with feedback received from residents about queue time, and the agency understands that during emergencies, seconds of waiting is agonizing. Focused on strengthening the recruitment pipeline, we also launched the Junior Academy, which graduates students from the program in the first year, representing 17 district high schools. This program supports the bolstering of a pipeline of qualified candidates to fill critical vacancies. This free of cost 5-week program familiarizes high school students with OUC career opportunities that they can leverage upon graduation. It also provides participants with exposure to the public safety communications ecosystem and provided youth who represent and reflect DC residents an understanding of the city and district culture. They are invested in our communities and the opportunity to explore and develop new career goals, learn from professionals, and build a network. You can learn more about that or register at ouc.dc.gov. Also in fiscal year 23, we made demonstrative progress in agency efforts to enhance transparency. In particular, the launch of the 911 Performance Dashboard provides insight into the work that the city's first responders do each day. Last year, of the nearly 1.8 million 911 calls received, 77.86 were answered in 15 seconds or less. In fact, the average 911 answer time was 12.03 seconds. Additionally, in fiscal year 23, the 911 operation handled 10,136 text to 911 sessions. The operation also dispatched FEMS 228,820 times and MPD 643,331 times, with over 10 million radio transmissions. Throughout this last year, OUC collaborated with Fire and EMS and MPD to ensure the collective efforts of the agency are aligned as closely as possible. For example, Fire and EMS personnel, along with the OUC training specialists, completed feedback fluency training to assist with quality assurance reviews. Additionally, MPD cadets and tenured members completed chairside observation, during which they were paired with call takers and dispatchers to observe real-time incident handling. Also throughout the year, OUC worked closely with the PSJ cluster agencies on the implementation of the PowerPhone Total Response call processing protocol system, and will be making that transition soon. OUC remains committed to taking tangible steps to enhance racial equity in its programming. The agency centered outreach and public education programming and analyzed request trends in Wards 7 and 8 and engaged more directly and frequently with the Latino and Latina community and others with limited or no English proficiency. To ensure achievement of these strategic objectives, OUC identified a diversity, inclusion, and racial equity program lead and a language access coordinator who are participating members of the Office of Racial Equities, or ORE's, Planning and Development cohort. OUC developed a racial equity mission statement that aligns with ORE's vision and mission for the district and created the draft plan in accordance with the requirements. Through fiscal year 23 to present, OUC engaged with more than 30,000 residents at dozens of community events and resource fairs to raise visibility of services available through 311 platforms in these and other targeted communities across the city. In fact, due to these concerted efforts, service request submissions in Wards 7 and 8 increased in the last 2 fiscal years by more than 8,000 service requests. The agency's participation in core team walks and its Live with the ANC events were highly effective in engaging with community and presented opportunities for the public to learn more about how DC 311 supports the removal of blight and provides convenient access to service for all. By the end of this fiscal year, fiscal year 24, the agency will have launched an enhanced service request portal and mobile app that features the ability to translate 50 service request types to Spanish and an additional 100 in the 6 most spoken languages in the district. OUC is clear-eyed about where the agency has fallen short, critically evaluating performance to understand root causes, integrating best practices and stakeholder feedback, and reacting quickly to implement changes. Thus, the OUC approach to achieving the highest level of performance possible is directly tied to its focus on 3 pillars: our people, our training, our technology. To this end, in fiscal year 23, OUC created an agency wellness coordinator position. I'm proud to announce this employee will start with us on Monday, and she will serve as an ambassador for employee well-being. She will act as the OUC's main point of contact on wellness-related programs and campaigns, assist DCHR with monitoring and evaluating to ensure employees are being effectively engaged with substantive programming, encourage employee participation in wellness activities, and create enthusiasm around leading a healthy lifestyle. In addition to our workforce completing more than 22,000 hours of role-specific training, OUC has also implemented a new policy that details requirements for operational employees to complete a minimum of 40 hours of training every fiscal year, and those in the IT and administrative divisions, including chiefs and the executive staff, to complete a minimum of 24 hours in addition to the sessions mandated by the district government, like cybersecurity and sexual harassment training. In the coming weeks, OUC anticipates that the agency will begin to realize benefits from recent investments in technology, in particular the integration of the standards-based call processing protocol system, PowerPhone Total Response. Will ensure that the call takers finally have at their fingertips technology that is responsive to callers' needs. This technology uses a proven and patented investigative questioning approach that helps enhance caller and responder safety. Consistent call handling is the foundation of effective and efficient response, and we also anticipate that once this solution is in place, diversion of calls to the nurse triage and the Department of Behavioral Health Access Helpline will increase. I'm grateful for the testimony shared today by members of the public and continue to encourage the use of our performance feedback form, which is on the OUC website. Please use this form to share concerns, suggestions, complaints, or compliments about OUC programs and our amazing staff. Collaboration with our stakeholders enables us to provide the best service possible, and we deeply value our engagement. Chairperson Pinto, Councilmember Parker, and committee members, thank you for your time. This concludes my testimony, and I look forward to answering any questions you may have.
Thank you very much, Director McGaffin. And we are going to do 10-minute rounds for members, if anyone else is joining us online for your awareness. Well, thank you for your testimony and for all of the effort that you and your team engage in all year long on very tense, important work for the safety and well-being of district residents. You are the first responders, and we deeply appreciate that effort.
Thank you.
I also want to recognize how responsive you and your team have been to us and our committee with specific incidents that we're looking into as we all work together to improve outcomes. I do have some concerns, particularly about the status of investigative reports and outcomes that we will get to. But I want to start with probably the most frequent concern I hear from residents about OUC, which is around call times and repeated incidents where folks were telling us that they called and nobody answered at all. And I understand from your performance oversight pre-questions that the percentage of 911 calls answered within 10 seconds was at 90.5% in fiscal year 2021, then went down to 85.9% in fiscal year 2022, and then again went down to 74.4% in fiscal year 2023, which is a very alarming trend. And in your explanation, you stated, quote, performance around this KPI has continually improved and remains steady. But we've seen a drop from 90% to 74% over the last several years. So how do you square those two things, and what are we doing to make sure that when people call 911, someone is answering?
Sure. So call answer time is directly reflected in a number of call takers that we have. And so when we're doing a couple of things, so the one thing that we're doing is that everyone who works at OUC as a dispatcher currently in their job description, they are supposed to be a call taker and a dispatcher. That was not happening. They are now all going through the training to become call takers. So a lot of them chose maybe on their own to keep that skill set, to keep those dual school skills set up, but most of them did not. And so, or they weren't afforded the opportunity to do so. So now, as we're moving forward, as we're introducing the new technology, every single person who is a call taker, dispatcher, manager, supervisor, all the way up to our operations managers will have the ability to answer 911 calls, will be certified to answer 911 calls for medical, police, and fire. The second thing is reducing the vacancies. We were to a point when I first got here as director, when I was first appointed as director, where we had nearly 57 vacancies in call taking. Today we have 14. We were supposed to have 6 people starting on Monday. I think that that has been shifted because of some suitability testing that we're waiting on, but we're working very, very hard to decrease those numbers. But it's not instantaneous because when we bring them in, then they have to go through about 16 weeks of training. Not everyone's going to make it through training. And so there is a little bit of time there. When we talk about the numbers, the national standard changed from 10 seconds to 15 seconds. So it used to be that 90% of the calls had to be answered in 10 seconds or less. That national standard has now changed to 15 seconds or less, which I think would describe that report, and then we report it on our dashboard. And last week we were actually in the 90s, 6 out of the 7 days. So in this moment in time, we are seeing that improvement.
Okay, and in the metrics that you report out, is it only accounting for calls that are actually picked up for the length of time that it takes to answer the call? Or are you also accounting for calls that are never answered?
Accounting for the calls that are not answered is the standard. So it's the total number of calls.
Okay, and that goes into the average
Yes,
number.
any call that hits the system, the 911 system. So we're, those are counted in our calls because, they presented to the 911 system to be answered.
Mhm. Okay. So last year we talked about the protocol for if a call is answered and nobody speaks on the other end of the line. And you shared that it was the practice of OUC to hang up if that happens. And while I am sensitive to the volume of calls that you all are dealing with, I'm very worried about a couple of circumstances in particular, somebody choking, having a heart attack, domestic violence victim, all of which are not going to be able to speak in that emergency moment. And so in the last year, have there been any additional steps taken to improve outcomes for these categories of cases that aren't able to speak?
Yes. So now we have call takers ask several times, they're trying to find good location. I know location determining technology is always a hot topic. Only about 60% of our calls are coming in with a dispatchable location. If we can find a dispatchable location, we can send a card to MPD for investigate the trouble, to just say, hey, somebody here called 911, is everything okay? We also listen for cues on the phone. Do we hear something? Are we hearing anything? Does it sound like it's just a pocket dial? So we are taking some steps to kind of decrease that and sending police for investigate the trouble.
And what does the training look like for when police or fire should be dispatched for investigative trouble?
We really, that is kind of more a subjective thing. We kind of give them some examples. We can play calls for them in training. Like, this turned out to be a choking. Are we listening for things in the background? Does it sound like you're just in a crowded place? And, if they're, the background cues or the background noise is a really good indication of things that are happening. We also look at history. So we have an example that we use in our training is there was a domestic violence caller and no one was talking on the line. We looked at the history for the residents and we saw that there was a history of domestic violence. And so we immediately sent it and let the officers know that there was a history of DV at that residence.
Okay, and all of that past history comes up on the system during the call?
Yes. Anything related to that address or any nearby call if it's an active call.
But in the case of a DV victim not speaking, is the address populated by the GPS tracking?
Sometimes it is. And one of the things that we try to work really, really hard on is for support groups to not pass out non-initiated cell phones. Non-initiated cell phones is like, I have this old iPhone, let me give it to my child. Those phones can still dial 911, but they don't come to us with location. They're not initiated. And even with Wi-Fi calling, they don't have that address attached to them anymore. So working really hard with the Office of Victim Services and judicial grants, as well as the Domestic Violence Task Force that I am, to really stop doing that practice and give victims initiated cell phones so that we are getting good locations so that they can put locations in. So if they are calling on Wi-Fi, we can do that. And then also working with groups across the city to always encourage everyone to have Smart 911 on their phone.
Okay. My next line of questioning is going to take me more than 2 minutes. So I'm going to turn to my colleague, Councilmember Parker, for a 10-minute round.
Thank you.
Thank you.
Director, I wanted to come back to the key performance indicator very quickly. You're saying that you made the transition to a different national standard. The reporting in the pre-hearing responses still stipulate the 10-second response. So I'm hearing what you're saying is that, we switched, I believe in 2020, to the 15-second standard, which, Nina, is the standard.
Yes.
However, your reporting is still based on the National Fire Protection Association standard of 10 seconds. Why the discrepancy? Was that just merely a carryover from previous reports, or is there something we should read into that?
I'm gonna let the deputy director, she deals a lot with the statistical, if that's okay with you?
Yes.
Yeah, okay.
Yes, your depiction was correct. What the adjustment is a carryover, but in this fiscal year, the plan does state 15 seconds as opposed to the 10 seconds.
And what's the percentage for the 15 seconds? Is that the 74.4% that it's documented? Or
I
is
need
that
to-
based on the 10-second?
I'll need to take a look at it and see, but we'll get that information to
Okay.
you.
That would be very important to know. So I would appreciate if you could follow up on that. Director, I want to come back to just inability to get information. And I also appreciate that you are a director that is responding to someone else, namely the mayor and her agents, district government leads. Question 69 in your pre-hearing responses asks about the after-action report that OUC promised the committee last October in response to the district dogs incident, yet we still don't have that. What is the status of the report?
So this is what I will say. I can talk about OUC. As we know, there's been a change in HCMA handles the after action report. So for the Office of Unified Communications, we participated in that after action. We provided the information that was requested. And we also looked at how we were handling things. We worked with fire and EMS to get more training. As we had talked about, when we were training for flooding, we were training for outside flooding because we had really.
I understand that. I
sure.
want to just keep it on the report. So is your response that it is not up to OUC to produce that report? It is HCMA.
Correct. We produce what I know to be true, and what I can say about OUC and our part of that is we identified the things where we could have made improvements. We made improvements and changed policy to do so.
Okay, so I will then bring you to question 68 that relates to Bernard Baker, who died of cardiac arrest. There were questions around staffing levels at OUC, which is in your purview. And
Sure.
yet your response is information about this incident is not available to the public.
I don't have exact staffing numbers in front of me, but we will circle back
When?
as soon as we can.
So the committee issued these pre-hearing responses, I'm assuming many months ago. And the response that the council has received is you're not going to give us the information.
I will follow up.
So if I were to ask by the end of today, by 5 p.m. today, could OUC produce the staffing levels for the date that Bernard Baker died, which was in April of 2023, we will get that information.
I will do it in a timely manner. I can't tell you that it's going to be at 5 o'clock. I'm,
Okay. So what I'm struggling with, Director, is there's a pattern of asking for information and then we don't get it. And the executive essentially says, we're not going to do that. And DC code, for those that are watching, 1-301.44C precludes district agencies from withholding documents or information requested by members or staff of the DC Council. So legally, a district agency cannot respond with, I'm not going to produce that information. And I will bring your attention to the CAD report related to the district dog situation. I personally requested that information following the aftermath of the district dog's flood and was told there was an ongoing investigation that was leading to this report that we've never received. Now you're pointing us to HSEMA. When should we expect the CAD report?
when things, so I just want to be clear about this, and I understand what you're saying, and I can appreciate that, right? So what I am saying to you is sometimes if there are other, is that there's other litigation,
There
I
is no
can't.
litigation related to district dogs.
Okay, I will talk with my general counsel and again, I can get back to you.
So to be clear, my request on behalf of the council in respect to Chairperson Pinto, so I would ask that you share with the committee and she will be sure she shares it with me,
Absolutely.
is that by 5 p.m. today, that we receive the CAD report involved with the district dog situation. And it's my understanding that there were several. I've seen the CAD report because it's floating around on social media, which is further offense that my request of the director of the agency received a no, not yet, yet the general public has it because someone leaked it internally, I would assume. And secondly, the staffing levels for the date that Bernard Baker Jr. died. And I would just highlight again, these aren't first-time requests. The committee has asked the agency for this months ago, and members of the public have long asked for it as well. Okay.
Thank you.
I would also remind you that you are under oath, Director. And so I don't say that lightly. I'm just saying, I want to make sure we're on the up and up, and the response just cannot be, we're not going to give the information.
I completely understand, you know,
Okay.
and I wouldn't,
All right, I
Thank you.
want in my next 3 minutes to transition to PowerPhone. How much was the district spending on its previous dispatch system, or I guess in parts, the current system?
I am not sure exactly how much we were spending on that. What I can say, and we'll certainly, you know, we can get that for you. What I can say, the city was using the electronic criteria-based dispatch program, which was a homegrown program out of Seattle, King County, Washington. Prior to that, the city was using the National Academy's emergency dispatch protocol. There was a change. It's my understanding that there was a change when the fire chief came. When Fire Chief Dean came and brought that protocol from Seattle, King County. That protocol is end of life. It's not being supported outside of Seattle, King County. In fact, they themselves are now looking for a new protocol system to use. And so it is also not standards-based. There are 3 standards-based programs that align with the NENA standard for call processing and protocol systems. And so we looked at all 3. And we met with members of FEMS, MPD, DBH, as well as we solicited volunteers for working groups for this from dispatch and call taking. And we looked at everything and we said, what are the needs of fire and EMS? What are the needs of MPD? They gave us their needs, and then we brought them back PowerPhone and said this one would be the best for the needs, specifically for the medical director's needs of trying to divert 911 calls away from ambulance dispatch and more to the nurse triage line.
So am I to interpret from that fire and EMS and medical partners want PowerPhone as a service?
They want what is going to get them the best response, and left it to us as the industry experts to go out and see what the ideas were and bring it back to the table and present to them. And we've been able to do that with PowerPhone. And we also with PowerPhone can integrate some of the things that they already have, such as Pulse Point, such as TCPR. The council.
So specifically related to fire and EMS, I have read accounts that PowerPhone potentially can overwhelm fire and EMS, in part because of what Ms. Knox was pointing to earlier, the sense of over dispatching, that a theft versus robbery or whatever the case may be. I just want to be clear. This was a OUC decision to transition to power phone, not necessarily the entire public safety apparatus decision.
We brought this solution, that's correct. I will say this to that point. MPD and DC Fire, not the medical director's office, but DC Fire have both tested and are both signed off on and 100% happy with PowerPhone and how it looks, works, and feels today.
Okay. How much is PowerPhone costing us to transition to?
It was about 532,000.
Is that annual
No, that was the
costs?
implementation.
And what would be the annual cost on average?
80,000.
80,000.
And that is in line with the other products that are out there.
And in my last 2 seconds, what other cities or the largest city can you point to that might be using PowerPhone as a model for what we can expect?
As far as largest cities, I don't know that right off the top of my head. What I do know is over 700 911 centers across the nation use it. There are only about 6,000. Most of them are not using any sort of protocol system. That is a fair and accurate statement. What I will say is this one provided the most ability to customize for the Office of the Medical Director so that we could get calls to the nurse triage line and so that we could get calls to the Department of Behavioral Health's Access Helpline. And if I was saying what was the decision point, I would point to that it
Okay.
allowed for the customization for our many diversion programs.
All right, I have more questions here,
Sure.
but I am out of time. Thank you.
Thank you, Councilmember Parker. So I want to pick up on some of the concerns about transparency. And the council passed an emergency bill this summer requiring OUC to establish a public dashboard so we can all be on the same page about errors. And I want to commend you and your team for getting that dashboard up and running so effectively, so quickly, and have been great partners in that. But we still need much more information around incidents and after action reports. And so I want to speak with you today about what happens after a serious incident occurs. It's one thing to know that there was an error, but then we need to know what happened so that we can make sure that it doesn't happen again and that everyone has the tools that they need. So can you walk through what OUC's policies are when you're notified of a potential error or another problem with a call response or a dispatch?
Sure. So as soon as we get the information, we start an investigation into that. We include our deputy director's office who leads the investigations, as well as whichever division would have been involved in that. Typically in this situation, it's 911. And so we pull all of the call records that we have, the telephone calls, radio transmissions, CAD reports, things like that. And we typically create a timeline for that. And then from that timeline, that really tells us a lot about what transpired. If interviews are necessary to talk to staff about on the floor, then that happens, with our deputy director. And every single call that is brought to our attention is also put through a quality assurance program. Even if, if it's for a long wait time, we look at all of that. What was happening on the floor? How many people were staffed, things like that. And we put together findings. Then once we put together the findings, if it was a person, if there was an error made by a person, then we certainly start the process as far as training and or discipline in the disciplinary track.
Okay. And how many open investigations do you have right now?
None. I have the one that you sent me, and I talked to the resident today, so I do owe you. I talked to her yesterday. I owe you just a response to that, but that's the only one.
Okay. And does that mean that all the investigations over the last year have been concluded?
Yes.
And what is
I'm sorry, from our perspective. Now, if things are pending MPD investigation and things like that, then. But everything else from our perspective is closed.
Okay. And so what is OUC's policy on sharing information publicly at the conclusion of the investigation with the public writ large, with the victims' families, or with the council?
We share information with you. We try to keep you and the committee abreast of what we have going on. And then the families, if we've been able to make contact, we reach out to them and share with them.
Okay, and what about the public?
We've never, I mean, there are things we've put out executive summaries and things like that. But a lot of times we have to really consider the situation and, the people who call. So it's one of the questions that we talk about as 911 professionals a lot, and that's, is there a right to privacy as a 911 caller? If I called about something, do I really want that information put out to the general public?
Right.
And sometimes, chairperson, the families and others, whereas they may have initially been, maybe amenable to that, once we have found other things and other records related to the situation, they have requested that we not share things publicly, and so we are very sensitive to that.
Okay, thank you for that. I guess we're trying to figure out the distinction between the communication that we have with you all when there is an initial error or an investigation is open, which is different from getting the final report and conclusion and analysis that you all have finalized that we need to see.
Sure. So usually one of a couple of things happens. One, we're either making policy changes or we're implementing new training or new standard operating procedures. And so a lot of times that's where that kind of ends up. And sometimes it's disciplinary. Those things already existed and the person didn't stay course to what the mission is of OUC. And so we handle that. And so, I mean, those are really the two routes. And then, of course, there's always the unfounded route, or we need to pass this on. Sometimes we get, complaints that I call 911, but it never connected. And so, as you know, and I've kind of said before, when that happens, we try to trace that back to the telephone carrier. And if they did not connect a phone, because the 3 major carriers have to connect any 911 call, that we do report that to the FCC for non-carrier delivery to the 911 system.
Okay. And how does that policy differ when another agency is involved, like FEMS or MPD, that may be doing their own investigation? What are the policies in place for when those reports can be shared with the committee?
So we only share the things that we have. I mean, if FEMS has access to CAD reports, as does MPD, they can also request that through our transcription unit. So our investigations, unless it's a larger incident and it becomes an after action that's led by HCMA in the cluster, then, we're doing our own. And any complaints that we have or any concerns that we have with our other agencies, we have a channel to pass those back and through to, because, with FEMS, we have 3 officers that sit on our operations floor daily, as well as a chief who's a liaison. And then for MPD, we have a commander, and soon within the next 2 weeks, we'll have 4 sergeants that sit in communications with us as well.
It's my understanding that the responsibility for the after action reports was moved to the Office of the Deputy Mayor for Operations and Infrastructure. Can you elaborate more on why that change was made?
I don't have any information that I could provide on that. If we're asked by our cluster, our deputy, we provide the information, so.
Okay. What we need to figure out, and I hope together, is we have a trust problem right now in the public with OUC. I think due in large part to a lack of transparency about the finalized analysis of these reports and investigations. Not just a recognition that an error happened, but what was actually done about it. And that lack of transparency leads to a lack of trust, which leads to poor public safety outcomes. If somebody is less confident in calling 911, because these stories are understandably and rightfully upsetting and they become part of the public sphere. And so we need to figure out how to do more to ensure that the analysis and the conclusion of the investigation is communicated with the public, not just for kind of hand wringing and finger pointing, but so the public can have confidence that there was sufficient follow-up action taken. And so that could look like a lot of different things with other agencies. We require those reports be public. And so I'm hoping that we can work together on improved outcomes in that regard before we have to go there to improve it.
Absolutely. Thank you for that opportunity. I want to, in this very public forum, say that, and I kind of said it in my opening, that we understand that there are issues and we're working really hard to fix those issues. But 1.7 million times more than any other state in the 50 states, people rely on the 911 services that we provide. And there are issues, and I'm not trying to minimize that in any way, but they're far outweighed by the positive outcomes that we have. And so I don't ever want there to be a trust issue between the public and the great work of the OUC employees.
Well, thank you so much. And I appreciate you sharing that for the record. And I extend my gratitude and belief in the folks at OUC to be able to handle such a huge call volume. But when we talk about these specific instances,
Sure.
so, let's turn to the call at 13th and Upshur that was loaded as northeast instead of northwest. This was kind of a good, simple example on understanding how the agency deals with errors. It was the wrong address dispatched. What has OUC released about that call error?
So that is on our dashboard, I believe, and it came in. So a couple of things. It first was flagged immediately by the dispatcher when fire told them this isn't right. The dispatcher did what they were supposed to do. They immediately notified a supervisor. I was immediately notified. The outcome there was personnel matters and retraining, and that information, I believe, is on our dashboard. And then there was the FOIA request that was then put in. And so we answered that.
Okay, so on the dashboard, it includes which piece of
The findings and what the outcomes were, what we did.
okay,
That's,
okay,
I believe that should be in there.
okay, we will pull that up now.
Okay.
Thank you very much. Councilmember Parker?
I'm going to come back to PowerPhone. Director, can you speak to the database outcomes you're hoping to get from this transition?
To PowerPhone?
Yes.
Sure. So right now, the PowerPhone system or the ECBD system that we have doesn't really have a records management system attached to it directly. And so it does feed into both FEMS and MPD's record management system. But I know yesterday, your colleague asked Chief Donnelly about oversending, and that's a big problem here, right? Sometimes we're sending ALS when it should just be BLS. And one of the things that we looked at to help mitigate that situation is in this new RMS system, we can pull calls based on type. We can also pull calls based on if we sent ALS and it was BLS, it'll show us that data in a really clean way so that the Office of the Medical Examiner or the medical director, can then say, hey, you know what, on this type of call, we're not going to send ALS anymore. We're going to originally send BLS. If they need ALS, they'll call for it. So there's going to be really clean reporting systems, and it also feeds into a new quality assurance system that we have.
And you're touching on actually one of the concerns that I keep hearing, that it's going to have devastating impacts on ALS dispatch and this concept of over dispatching for some of the reasons we've discussed. So yes, we will have the data, which will help. How can we safeguard that we don't wake up and realize, wow, we have a big problem given that we've transitioned?
Sure. So right now, when a caller calls, the call taker chooses if it's ALS, BLS, or nurse triage line. There's nothing there telling that person to do that. So if the four of us were all to take the same call based on our training, based on our past experience, we might all pick a different thing. This system doesn't allow for that to happen. It asks the questions, and then based on FEMS triggers, it says, this is BLS, this is ALS, this is nurse triage. And actually, there's a cadre of FEMS employees at OUC right now testing those triggers and making sure that they're competent
Understood.
with those.
I want to get to more specifics. So what decrease in errors do you hope to see given this transition?
So this system will have to be launched for every call. The system now, you can bypass it. And so with certifications, with new policies, this will launch and will be used for every 911 call that comes into the 911 center. And so we'll even be able to track if the person didn't need 911 services at all. We'll be able to
What
track
I'm
that.
getting at is how do we measure success? What I don't want is that we spend a lot of money, time
Sure.
transitioning, and then next year we see key performance indicators and they're even lower or about the same.
Sure.
So where would you point us to look for success of this transition?
I think eventually, not immediately, because I think we're going to have a little bit of some time where it might, as our call takers are really getting used to it in a live environment, it's going to take some time to get used to the questionings. And so how we're asking that to the public, but over time, it should be really streamlined because we're not going to have 900 call types like we do today. One of the exercises that we did with FEMS and MPD was we consolidated call types. So for example, for kidnapping, there used to be 9 different cards for kidnapping. And so you'd have to pick the card and then you'd have to decide what questions are asked. Today, now in the new environment, there's one, you ask all the same questions, and based on how you answer those, it gives you one of the 9 responses for MPD.
There's a consolidation
Yeah.
of the cards. But again, where would you point us to look to measure success
Sure.
in terms of indicators?
More calls to diversion programs such as the nurse triage line and the behavioral health access helpline, as well as DPW's parking and DDOT's non-injury crash things, because right now we're still sending MPD officers to that sometimes, and this won't allow the call taker to do that. Now, if something changes, they can have that guided flexibility to make some changes, but it'll show us exactly why they didn't send it, and then, you know, they'll have to note why they sent something
And
different.
in terms of timeliness of answering and or dispatching and or errors, do you anticipate improvement in those areas?
Absolutely in errors. Timing, I really hope that it does as we become more familiar. And I'm sorry, Councilmember, the third thing.
Those were the two.
Oh, correct event types. And,
Yeah.
and yes, with correct event types. And we already have a plan, a review committee set up. That's also a national standard that we weren't doing before, but we'll review everything with everybody within fire and MPD every 3 months, and actually probably every month as we get started to make sure that we have everything exactly like we want it.
And the launch of this new system is April.
So
that accurate?
we're hoping for before. We have 100% sign off on fire events. We have 100% sign off on MPD events. We're just really tweaking the medical because that is the lion's share of what we're trying to divert away and to help the whole system, right? Because if we're putting too many 911 calls onto the dispatch board, that's tying up ambulances, which is eventually tying up hospital wait times, which I know is a concern.
That is super helpful. Can this, I shouldn't say can, please share those reviews with the committee
Sure.
whenever you're having them, whether it be every 3 months or monthly, because in terms of transparency, what Chairperson Pinto was talking about, I think that would be important for us to
Sure.
know.
And I welcome you all to come over anytime and we can show you, in our simulation lab, exactly what it does compared to the technology we have today. So,
Awesome.
thank you.
I want to turn to staffing issues. Well, before we go there, I just wanted to come back to something Ms. Knox said earlier, that her members are really worried about the transition to Power Phone. How are you addressing that?
Change is really scary. We have a lab set up right off of the communications floor. They are welcome to come in anytime. They can come in on their time off, for overtime training. They all have taken 20 hours of training for this program specifically. Our training division has made themselves available to all 4 shifts to help and assist in that way. And we have simulation labs set up that they are able to come in and play around with. And learn and ask questions about. When we we also had the working group, and I know the question was asked, how do we get that? Every working group or every opportunity that we have at OUC is put out in a survey form using our new Power DMS system, which goes to everybody at the same time. They can go in there, they can look and see what's happening in the agency, and if there's a working group that they'd like to be a part of, then they can do that. If they would like to be a recruitment ambassador, they can sign up for that there, and that's how we got the.
And that
people.
working group, are members public? That was something else that was requested.
We do not have public. We have FEMS frontline operations, MPD frontline operations, as well as 911 operations.
But you're not making public who's on that working group.
We have not at this time made public who was on that, but we can share names if that's helpful.
Okay. I wanted to come to staffing. What are the minimum staffing requirements for call takers and fire and EMS dispatchers on a 12-hour shift?
Sure. So for call takers on the day shift, because we take more calls during the day than we do it at night, it's 22 call takers, 4 supervisors. On the evening shift, it's 4 supervisors and 18 call takers. For MPD, it's always the same 12 dispatchers, and for FEMS, it is 6.
Okay. And just why the discrepancy between FEMS, MPD, and general call takers?
Okay, so for the police dispatchers, it's 12 because that's how many we need to run all of their channels. So
Got it.
it's all dictated by channel on the dispatch side, so for FEMS and MPD. And then the call taker side, the industry uses an Erlang C calculation, which is a call center calculation. And then we typically add 2% to that number because we know that we have spikes and influx. And we also know that we have people out on long-term leave, FEMLA and PFL, that we have to account for.
And has OUC met these targets in recent weeks in terms of staffing?
I don't have exact numbers in front of me, but that is on the dashboard, and we can certainly turn to that and
Okay.
get that to you. But what I will tell you is we staff for those numbers each day. Last week we had a shift, they all had the flu because they're all sitting together in close proximity for 12 hours. So when that happened, our call takers, our 911 and 311 manager, we were all answering the phones on the mound as was described earlier, which is like the supervisors. We were doing the supervisory duties while our supervisors were call taking and dispatching.
Okay. I am going to hold off until my next round, but more to come on that.
Thank you.
Thank you, Councilmember Parker. So Director, I want to turn to some of the DC auditor recommendations. In the past few years, the auditor has made about 31 recommendations for improvements at OUC. And in my estimation, OUC has been doing a great job in implementing many of these recommendations. And I want to commend you for a lot of this work, which is very promising. I want to ask you some questions about some of the remaining recommendations
Okay.
that have yet to be seen. So for the recommendation to reduce call types and simplify pre-arrival instruction systems, has the training on the new protocol system been implemented for reduced call types and simpler pre-arrival instructions? I know that PowerPhone, which we'll get to in a little bit, is key to this recommendation. Are there any outstanding concerns about implementing this recommendation with a new software?
No, actually, instead of trying to make lots of big changes in parallel, we made the decision to make the changes when we were starting the new software. So all of our call takers and dispatchers have gone through the call type software, or I'm sorry, the call type training, and then as well as the call software training. And so we did that in conjunction so that we can show them what the new call types are and show them how to put those new call types into the system. So we did that. And so the second part of your question, Chairperson, I'm sorry.
Are there concerns about implementing that recommendation with the new software of PowerPhone?
No, in fact, we did it kind of in a cadence so that we would make the changes with the new software.
Okay. So is that an expected recommendation to be complete? Do you have a timeline?
Yes. So as all of the training piece is done, except for the people who have been out on long-term leave, as soon as it is implemented, that box can be checked because the new call types will all be in that system.
And so what's the expected timeline for that?
As soon as we get the 100% from EMS regarding their triggers and their call types, we can then take that next step. And I just want to commend them. They have worked through holidays and around the clock and a lot of different iterations, both their team and ours, to kind of get to what that is. I don't want to get a date and then not be truthful to that. So we'll keep you in the loop with that.
Great. For the recommendation on location-based routing, the auditor recommended developing a policy to verify addresses using LDT, location determining technologies. And I understand the agency is awaiting cellular carriers to deliver the needed data. Since OUC has the proper equipment and technology now, can you explain in layperson's terms what's going on here and where does OUC stand on this recommendation?
Sure. So on January 27th, the FCC put out rules for 911 routing. That now means within 6 months, all of the carriers, all of the telcos or the LEC, the local exchange carriers, have to make sure by August, the end of August, that they're delivering everything with a good dispatchable location. That location is still a metered radius. And so when you're out in a rural area, that might be okay. When we're in more of a suburban area, it's not as great because it could be a multitude of buildings. So we are following that closely. As soon as we are testing and seeing that the carriers are delivering that in a way that would be meaningful and not a hindrance to our mission, we'll put that policy in place. But it's really dependent on the carriers and we will hold them accountable to the FCC. If we're not getting that location by August, we will report that.
Okay. Can you speak to some of the benefits or drawbacks of location-based technologies versus having the caller share their address and how you've made the analysis on how you handle it?
Sure. So sometimes people are a third-party caller. So if we use their location, they're like driving to a parent's house or driving to a location where the emergency is really happening. And so in those instances, we always try to make a third-party caller a second-party caller. We try to get them closer to what is that's a goal of 911. So if we were to use that location, especially knowing that sometimes we're not getting a location from a non-initiated cell phone or things like that, we really wouldn't be doing anyone any favors. That's why it's been really important in our continuing education new policy that we have. It's required for continuing geography. We are doing landmarks. We're going out on ride-alongs. We're doing all the things that we need to be doing to not just help our call takers really know the city, but also to know what the neighbors in particular communities might refer to things as, and adding those into our CAD system. So if somebody calls and says, I'm at the big chair, we can just put that in and it has a dispatchable location associated with it.
Okay. And are you finding in the training of call takers that complement of the objective information with the more subjective conversation, we're seeing improvements, or how is that implemented into the training?
Absolutely. We're seeing improvements there. And we've also added some technology. So if somebody calls 911 and there's a dispatchable location and the person is saying they're away from that location, a box pops up and tells them, hey, these don't match, have more of a conversation, and certainly holding people accountable there. Also, I think having MPD officers and fire department and really strengthening that relationship between our call takers and dispatchers and the field responders has been really beneficial. I just went on a ride along with a 2D officer on Friday night. So, there were things that I learned and brought back. So we're going to continue to do that and continue to strengthen our weaknesses. And unfortunately, we're in an age where people don't always know where they are because they're really reliant on cell phone technology. And so we're looking at other ways that we can improve that for them.
Okay, thank you.
Thank you.
There's another recommendation to monitor and encourage a method for selecting the correct chief complaint or call type, such as having a cheat sheet that helps with odd calls or common aired calls and where to place them. This recommendation cannot be completed until the implementation of PowerPhone, is my understanding. Can you talk about how this is going to be done once PowerPhone is up and running, and if you see any issues in implementing it with PowerPhone?
So we have a quality assurance program under our Office of Professional Standards and Development. When I came here, there were 2 people, now there are 12. And so we are able to do a quality assurance check on substantially more calls, and we're meeting the standard of 2% of our nearly 8 million. So with PowerPhone, it will give us a printout that will say, this person chose that, or this is what was selected, this was what should have been, or this person said yes to this question, but the call taker marked no. The QA system that we have in place is really intuitive. And so what it will do is it will show us, like, if somebody marked the wrong thing, if the person said, the person was 54, but the call taker put 50. It'll kind of show us those nuances, and then we can look for trends in training for the agency as a whole, the specific shifts, and then of course the individual. And we also have policies in place for remedial training. So now there's a remedial training program that if you meet that threshold to be in, we put you through the same remedial training program, which we had not had before.
Okay, thank you. Another recommendation was to use an automated dispatch function in the CAD system and the FEMS dispatch process, which would help to expedite FEMS dispatch and satisfy the 60-second national standard for notification. What's the status of transitioning to automated fire dispatch, and do you have the needed equipment to do so?
Yes, so we have the needed equipment. The needed equipment was reinstalled just probably in September, October timeframe. I then worked with Chief Donnelly, and it was important to him that frontline folks at FEMS be a part of that. So our Chief Information Officer, Gavin, has been working with Dave Hoagland, their union president, and they identified a group, and they've been working together to see if that is something. We are fine to do that, the automated system. We are just looking for FEMS's input if that's something that would be beneficial to them. We never want to implement technology on our end that hinders our partner agencies meeting their mission or goals. So that's where we are.
Okay, well, thank you for that update. And I will note, we just had our oversight hearing with FEMS, and they shared their appreciation for the partnership between OUC and them as well. I just want to, in my final few seconds here, ask about district dogs again. And I know you had a conversation with my colleague, Councilmember Parker, about this, but I am sensitive to what you're talking about with privacy concerns of some people not wanting their information shared. That is not present with animals. And I think this is a incident that has a huge amount of public interest and concern. And if there's no longer a pending investigation from OUC, can that be an after action report that is shared with the public immediately?
I didn't do the after action report. I did our piece, and I can certainly take that back as a concern.
But can you share the piece that OUC was part of?
I can share the policies that are in place and the training that we put in place after that event, if that's helpful.
But is there not an after action report on the OUC component of what went on there?
We had the timeline, and that was shared out to the media that day, or the day that we had the press conference. That was shared out. So we have that. That is what we turned over to as part of the after action review. And then the other things were really, we said, okay, we need to have flooding training. We need to change call types, or we need to do retraining on call types. And so we did that, and I have that information to share, but I don't have a formalized report that OUC put together.
Okay. So in terms of all of the other CAD reports that OUC has put together, with the understanding that not all will be shared, and some victims might not want that, can those be formally shared with the committee?
I can check with legal and get back to you. I know that might not, but I can't commit to sharing that out.
Okay. I just want to say on this, I know we talked about this earlier, that this is a really important thing for the committee to have access to, and other agencies have requirements to do so. And so I think before we get there,
Sure.
we should plan on having those CAD reports shared with the committee so that we can be on the same page.
I hear you. Thank you so much.
Okay, thank you, Director. Councilmember Parker?
On that, I just want to echo your concern. And it's a pattern, not just with OUC, but with the executive agencies not giving information, not following through, and or in some instances, not following the law. And we will certainly follow up. And there are steps the council can take, whether that's issuing a subpoena for the information, but I'm hoping the council doesn't have to go there because that is not the example we want to demonstrate to Washingtonians, that we have to take legal action against the executive. So I hear you, and we certainly will follow up. On the previous question that Chairperson Pinto asked regarding the mishandled call at 13th and Upshur Northwest, you responded that the error was listed on the dashboard. I know you may not have it up, but can someone pull that for me because I am not seeing it?
Somebody just pull it up.
And so we can come back.
Okay.
If a member of your team can pull
Yes.
that up, I am interested on it because I'm not seeing it. And I know in these hearings, sometimes something is just said and it kind of
Sure.
just floats out there. But if there's somewhere else I should be looking, I would like to do so.
And I just would like to say that this is beta, so I'm, if it's not there, we'll put it there, but it is my belief that it is there,
Got it.
as we scroll through, but we'll
Okay.
get that.
I am not seeing it. And so,
Okay, sure. RPIO, Anna's gonna look and see if we can get
Awesome.
that.
I wanted to come back to staffing. So, but before I do that, I keep hearing this refrain that we're the fourth busiest call center in the country after some pretty large cities like New York, LA, Chicago. It is my understanding, though, that out of those cities, our call center structure is very different in that it is a unified call center. How does those cities' performance compare to ours?
I haven't looked at that. So one of the things in the 911 industry that doesn't happen is comparative performance. We're starting to see data collection happen in that way. And so I will be quite honest that when I saw the graphic that came out that a couple of the news channels reported on last night, I myself was pretty shocked that that's where we stood amongst other states, really quite honestly. And so we're starting to do that at the national level. We're starting to talk about comparison, but what I do know is that a lot of places right now are struggling with increased call volume, staying on the phone longer, as well as also staffing. And so what I do know to be true is that with our new hiring initiative that has been underway since about March, we've had a couple of cities come to us, shadow us, and a couple of our people on their own time went to those cities and helped them implement that. So really proud of that. I'm also a part of the large PSAP consortium under APCO, which is this other one other than NINA. And we all, when we talk about what our concerns are, it's certainly call volume and it's certainly staffing.
Yes. And I'll be explicit. I have questions whether the unified structure is the best system. And so if other large cities have different structures and are seeing different outcomes, that would
Sure.
be worthwhile. And so I will follow up on that to just do some my own education on that.
I do know for New York City, we've been there and they've been here to us, and they are, it's my understanding that they're looking to maybe move to a unified system because it does cause delays. If I answer a call and now I've got to send it somewhere else, that's a delay. It also technologically is a little difficult.
Understood. Where are we today with staffing generally? I know you talked about your various hiring fairs and the pipeline issues. This is an issue that predated you at OUC. Where would you characterize we are today?
For call takers, I'm really proud of the progress we've made from, I believe there were 57 openings when I was appointed. There are now 14. 6 of those 14 will be filled as soon as we get the suitability test results back from DCHR. And I just want to say to Director Hall and DCHR, they've been really amazing to work with and understanding our expedited needs. But they are also relying on a vendor in that
Yes.
space. So we'll have 6 of those openings. We also, after lots of discussion and seeing what other places do, we've offered our dispatch position and our supervisory positions. Though internal, we want people to promote and we encourage them to do so. We've opened them outside to outside employment. And then also, so very grateful for the work by council for the Redeployment Act. We actually have someone who is in the process now to be hired, a retired firefighter. And so, he'll be the first and we'll probably get some attention because he is the first and trailblazing in that, but really grateful for that. And I've been working, to let their chiefs and then their unions also know when job positions are open. They are open right now. If anyone is looking for a job, you can go to DCHR and choose OUC. It'll show you all of our open positions. And so we are continuously hiring, which is also a big difference than what we were doing before.
And just to underscore, so we've gone from 57 vacancies for call takers down to 14.
To 14.
So we're certainly moving
Yeah.
in the right direction, and you should certainly be proud of that.
I am. I wish I could say the same for dispatchers. That's a little bit harder. But like I said, we do have new dispatchers starting. And we have also hired some part-time dispatchers. So people who might be certified.
What are the numbers of vacancies for dispatchers?
I believe on Monday it was 29 vacancies, and that's for police and fire. So definitely still a struggle that we're working through, but confident that we are on the uptick there as
And
well.
what's the average salary for a call taker and a dispatcher?
48.
If you had to
I
ball-
don't have that right in
had
front of
to
me.
ballpark
49.
it.
It's about 49 for a call taker, and then usually about 70 for a dispatcher.
Okay. Has there been any thought of increasing the salary bands for those roles?
So we were, New Orleans asked us to be a part of a salary study. And so we have that, we've shared that, and we can certainly share that out with you. One of the things that in my last meeting with council, I talked about the top to bottom assessment that OUC is doing, and actually salaries is one of those things that we're looking at in that, and that is slated as of now, with the latest OCP information to start in March.
Okay. I mean, $49,000, that is teetering on poverty in the District of Columbia for someone to play such a critical role in our public safety space. I mean, 74,000, if you have a family, certainly can have you approaching poverty. And so I definitely think that is worthwhile and may be part of the reason why it's been so difficult to retain and attract talent.
And if I could, I don't want
Yes.
to take all your time, but one of the big things that we talk about is first responders in this sense. Call takers are classified as clerical workers by the federal government. And so that's also a really hard pill to swallow, if you will, that you're coming every single day and maybe you're birthing babies or giving CPR instructions, but you're considered a clerical worker. And so really trying to do our part to get them the designation and recognition as being first responders in the city has been a priority.
Got it.
And not just the city, but nationwide, actually.
Nationwide. And just to make sure I'm clear, so that study, you're looking at that. It's also my understanding that you have a surplus, an annual surplus. Any thought of dedicating that to bonuses or benefits for call takers or dispatchers?
Yes, and we're navigating what that looks like through DCHR.
Got it. And when should we expect an update on that?
We work with them every day. In fact, we had a call on Monday about what was needed to make that happen. So as soon as I have an update, we can certainly share that.
I know this is going to be a tight budget year. But I would imagine many would agree that this should be a place of priority. And if you, as we approach this budget season, could dictate what the agency would need to lift both of those roles' salary bands, that would be helpful. So I guess the request there would be by March, if there was a proposal of sorts. And I'm not going to use that word because that may come in conflict with the executive. So if you could provide a hypothetical scenario of what salary bands for those two roles could be to raise them equitably, that would be helpful. So let's say by March 20th.
We will work hard to
Yes,
get that
to-
information
and
and see.
And I just want to be clear. I would imagine there may be a world where the mayor may say, we aren't going to do that. I'm not asking you to make a proposal. I'm asking, what would the dollar amount be for the amount of FTEs you have if their salaries were increased by X percentage point? Just to be clear.
Okay.
And I could follow up with more specifics. And what I would do with Chairperson Pinto on our side is go to bat to make that happen.
Okay.
All right.
Thank
Thank you.
I will, if maybe I could just maybe say this as well. So this region always is kind of tough to have employees in because every county that surrounds us also has a 911 center. But what I know to be true is we have a really stellar training program here. And what I also know to be true is some of them don't have the resources that we've been afforded to have the same training programs. And so sometimes what we see is people come here, they get training, and then they leave. So we're part of a National Capital Region study with the other 13 emergency communication centers or PSAPs, if you will, to try to maybe change how we're doing that. Because before a person even comes in the door, we're investing about $10,000 in them in their recruitment and the background and all of that. And then we're investing about another 10,000 in their initial training. And so the recruitment bonuses have been really helpful in that because now we have them for a couple of years because none of them are turning down those bonuses, and we're really grateful for that. But making sure that we also aren't just talking about recruitment, but we're talking about retention is really important to me. Only 2% of the people who start a career in 911 actually retire from it.
And if you were paying me $49,000, I probably wouldn't stay that long.
Sure.
And I get your point, and it's well taken that we actually, if we're investing in training people, we actually want to benefit from that. I completely agree. And so I'm just of the mind we need to raise the standard of who we're attracting. And I don't mean that offensively, but raise the standard, but also the compensation.
Sure.
For the folks. Thank you.
Thank you.
Thank you, Councilmember Parker. And I think you raise a really important point because OUC has been really focused in the last several months and years on hiring and getting people more interested in this important work in the agency earlier. And one of the things that we're contemplating legislatively is through additional bonuses to make sure that are available to your folks. But we also need to retain staff. And when I look at a $3 million budget surplus, it feels out of balance that we are losing folks who are leaving the agency, but we have this extra surplus. And so how are you thinking about the trade-off of using that surplus to fill vacancies and hire for more positions versus accepting perhaps lesser positions, but at a higher pay?
So for the lesser positions, that's really hard because the call volume really dictates what we need there. But I have an open door policy to all of my employees. They call me. I love to talk to them. The job that they do is admirable, right? And so the one thing when I talk to them about and what makes them think about other careers, very rarely do they say the money. A lot of it is the health and the life work balance. And so you know, it was really important for me to get a wellness coordinator, to have a person who could come in and develop from scratch a program that really helps them to find that. Because, you know, on a snowy Friday, when the snow started at 3:30, they're out shoveling their ways to their cars so they can make it into work. And so, you know, I want to be very, cognizant that I would give each and every one of them the world if I could, but I really am listening to them and hearing what they're saying. And health and well-being and training were the things when I had my last round of town hall meetings and one-off meetings that they all said. They wanted to feel more empowered in the work that they did, and they really wanted help kind of deciding what that life work balance is. So that's really where my focus was. And then I'll meet with them again and you know, we'll come up with new priorities and responsibility. I always talk about the three things: the people, the technology, and the training. The people, it's really two-part for me. It's the residents, the visitors, and the businesses of Washington, D.C., but it's the 400 people who show up every day. It's the people who didn't get to work from home during a pandemic, the people who come in when a loved one is sick. And so really trying to hear what their needs are and address those as best we can.
Okay, thank you. And what is the current status of filling vacancies that you have left?
So we are actively recruiting for dispatchers, both internal and external. We're actively recruiting for call takers. They're all external. They've never worked for us before. We also have our junior academy. That is the high school program that we have, and so we have that. We have the Redeployment Act. We're working with FEMS and MPD to you know, reach out to their retirees and let them know of this job position and how it does not affect their pension. We also have our the hiring fair on February 13th that we're taking part in at MLK Library, and then our prospect day called Leap Into a New Career on Leap Day on the 29th.
And so how many positions are currently vacant?
We have 29 dispatcher positions, 14 call taker positions. We have 2 assistant supervisors, 1 supervisor, and then we have a couple of admin or support role positions in IT and in the Office of Administration and Legal.
Okay. And how does probation work or opportunities for improvement? We heard from one of our public witnesses earlier that she was terminated and her concerns about that process. And so how does it generally work? And I don't know if you want to respond to the concerns raised by that witness.
Sure. So it's really hard to get a person in the door, so we never want it to be an easy out. We really pour into our employees. And I really have to thank our chief of professional standards and development, who's sitting behind me. She came in June of 22 and really has revamped our whole training program, our initial training continuing ed, as well as putting in place a remedial training program that aligns with standards and best practices in the industry. And so when people make mistakes and when errors occur, and we know that they will because there's a human element here, we, you know, try to find out what happened. Why did it happen? Was it that they didn't understand the technology? Was it that something else? There's something else going on, right? Like, did they themselves have a sick child at home and so their full attention wasn't here? So we always look at what the root cause was, and then we always try to do initial retraining. We wanted them to show us in a controlled environment what they would do in that same situation. We try to recreate the incident. And so alongside of using the DPM and disciplining, you know, in accordance with those rules, we're also really trying to train and retain our employees. And so I'm really proud of that work. You know, people separate from our agency, both willing and otherwise. But we really try to pour into training. And I can say unequivocally, if any person in our agency came to us and said, I don't understand X, Y, or Z, we would make a training plan and we would stick to that to have them stay.
Can you speak to the abandoned call issue that Ms. Richardson?
So yes, and I want to be clear that abandoned calls in the 911 sense are when people hang up from 911. So if a caller calls and disconnects before it's answered by a 911 call taker, that is an abandoned call. I believe, and I can only talked to what I believe to be true is what she was talking about was the location. And I kind of hinted on this earlier. Our phone system will input a location from the phone if it's available into our CAD system. You can choose to accept that. You can choose to abandon that location. What we tell our call takers and what is the standard operating practice for that is read what's in there. If they're telling you something different, have the conversation with them. I see you at 10:50 and you're telling me you're at 10:70, and have that conversation with them about the location. Now, if they're calling from another jurisdiction, if maybe they've, been transferred to us via another jurisdiction, that location comes over and it's dynamic. At that point, that location is no good to the call taker and they need to abandon it because a address in Prince George's County is not going to get them to emergency here in Washington, D.C. We take thousands of transfers a day for a multitude of reasons. And so we always tell them to use that. Don't abandon it if they're calling within the city. If it's close, have that conversation with them. Of course, abandon it if it's from an outside jurisdiction.
And what does that mean in practice? You say, of course, abandon it if it's an outside jurisdiction. What
Right.
happens to that caller?
Nothing happens to the caller. They're not abandoning the call. They're simply not using the address that was given to them by the location determining technology.
Thank you.
Yeah,
for that.
nothing happens to the call. You'd have to click X about 5 times to get away from the caller and the actual CAD card.
Okay, so the call taker is still working with the caller.
Yes.
It's just abandoned from the technology service.
No, it's just you're abandoning what was put in the location field.
So that's what I mean.
That's
the
all.
location technology.
All of our systems are they're independent of one another. We can not have CAD and have telephony. We can have CAD or we can have one without the other. They're all on different servers. They're all coming to us from different vendors, from different computers even. They're showing on the same screen because that makes it easier for our call takers. But they are independent of one another. If somebody abandons a 911 call, that has nothing to do with CAD. If we can't input cards into the CAD system, that has nothing to do with our radio system. They are all independent of one another.
Got it. Okay, thank you.
Mhm.
So we've been speaking a lot about PowerPhone today. Could we just zoom back a little bit and explain in layperson's terms
Sure.
what PowerPhone is and what practical impact you anticipate it will have on OUC operations?
Absolutely. So when I first became a 911 call taker, I would answer the phone. The person would tell me what was the emergency, and I would say, okay. It didn't matter what it was. If it was CPR in progress, if it was, I stubbed my toe, I would just say, okay. I would disconnect. I would put their address in. I would send an ambulance. End of the story. That's how it worked in 911 across the nation. 911 is very young. It's only like 53 years old next week. So what the national standards organizations put together were standards for call processing. And what that does is it makes sure that the call taker has tools in front of them to be able to take the call, correctly identify what the response for that call should be, and provide post-dispatch and pre-arrival instructions, including childbirth instructions or CPR instructions. And so the district used a system called the National Academy of Emergency Dispatch. Then they used the ECBD, which is in the industry kind of like a homegrown. Seattle made that, and then they sold it out to other places to use. And then there is now PowerPhone that we're going to. When a caller calls 911, we're going to ask them a series of questions. We're going to, of course, ask them their location, their name, their telephone number in case we get disconnected. Then we're going to say, tell us what happened. They're going to tell us what happened. We're going to type that in, stomach ache. It's going to give us a list of things that a stomach ache could be a trigger for. Sometimes people with stomach aches are having heart attacks. Sometimes they're having strokes. And so it's the goal of the call processing software to identify maybe those things and to make sure that we're getting the right response right away. And so if somebody calls in and they have a laceration to their hand because they were cooking and accidentally cut themselves with a knife, they don't actually need to go to an emergency room. They could probably go to the nurse triage line. The nurse can ask them a few questions. The nurse can make them an appointment at a clinic to get sutures. They can be home in about an hour and a half and not sitting in an emergency room for 3 or 4 hours. And so the call processing software is really just a phone triage system to get the call exactly where it needs to go and to not waste resources and to not duplicate efforts. So we're really trying, especially with mental health crises, to, instead of sending a police officer who then eventually might have to call the community response team, we're sending it to the Department of Behavioral Health, who would then be able to dispatch the community response team.
Okay, and is the expected implementation date still February 2024?
It really, we're hopeful, but we really want to make sure that this is right. And I've had really big conversations with both Chief Donnelly and Chief Smith about this. This is a big change. It affects everybody. It affects them out on the field. It affects us. And so we want to make sure that we're getting it all right and squared away. And so we're 2/3 of the way there. Just Dr. Holman and his team are really working hard to get us all the way there. But what we don't want to do is launch something that's going to be subpar. But that's the goal. If it's shifting, we'll let you know.
Okay, because it is February
It is
2024.
February.
So with the understanding that there are other agencies involved, do you have an estimate that you think that it'll
We
be?
talk, so our project teams talk every single day. And so we are just waiting on this final piece from fire. They're not a holdup. I don't want anyone to walk away thinking that they have not been a holdup. We just want to make sure that those triggers are right and that there's really confidence in that so that we can see some immediate relief for the hospital care.
Okay, got it. Thank you.
Mhm.
What sort of metrics are you going to be looking at once PowerPhone is implemented to demonstrate success or improvement?
Sure. So certainly diversions is going to be a big one. We have a lot of diversions here. Some have been a little harder to get all the calls over. Certainly, errors, because this is a guided tool. And so it's going to guide the call taker. And I want them to be able to breathe because this is hard enough. And so when they're using archaic technology or having to make 102 decisions, they take about 102 calls each a day. That's really can be daunting. And so I'm going to look at call volume. I'm going to also work really closely with our partners to make sure that we sent the right response. And the other thing with this program is it'll allow us to kind of make changes. So if we want to say today, hey, you know what? We need to add this kind of call type to go to nurse triage. We can do that, and it can be very day specific, where right now that doesn't happen. It takes us weeks to make changes in the background.
Okay. And, I think it's notable when you talk about how things changed in the industry when you started. But as we think about advanced life support, do you think that we'll see a reduction in those services with PowerPhone? And would that be cause for concern if PowerPhone is leading to risk-averse dispatches?
So absolutely. I think one of the things that happens today is people call 911 and they say, no, I don't want a nurse. I'm going to the hospital. And so our policy is changing around that. If it's what they told us dictates going to a nurse, they're going to go to a nurse, then they can talk with the nurse about what that looks like. But right now, I think what happens is we don't ask questions that really pinpoint what is happening. And that's what's leading to ALS oversend. It's an industry-wide problem. And so the questions that Dr. Holman and his team have come up with really help to eliminate that. And so again, this is really why we went with this program, because it allowed us to customize it for our community here in Washington, D.C. So when we're asking the questions, it's not just like, oh, maybe this is ALS. It's going to say ALS, BLS, nurse triage, and there's going to be a confidence number with that. And so it's going to say, I'm 100% confident that this is BLS, and it's going to send it over. And so it's not the people deciding ALS, BLS, or nurse triage. It's how the questions have been answered that's deciding ALS, BLS, or nurse triage.
And there still are opportunities for overrides in the event that the
Yes,
categories are not meeting what's being
correct.
communicated.
Or if something changes, you know, that can change. The
Mhm.
call type can change, the information changes, the dispatcher gets, a box pops up and tells them that it's been changed, the call type's been changed.
Thank you.
Mhm.
So going back to the dashboard, I want to thank you and your team again for working so quickly to get that up and running. We want to make sure that OUC is publishing all errors and complaints on this dashboard. So I know your team was looking for the Upshur incident. What we can see on the dashboard is that that's handled through the FOIA request process. Or that's what it says,
Okay.
and that it's not on there. So that should be on the
We'll update.
dashboard.
Sure.
And again, I think this is not only important just for awareness, but to improve trust, so
Sure.
that we're all on the same page in the public. Can you confirm that you will post all errors or issues on the dashboard, removing any private information, whether the source is internal or external, whether that comes from the public or the agency?
So we, even the ones that are sent up through our supervisors, we're adding. So I'll make sure. When you said the FOIA thing, that is correct, that we heard about that and we can add that one. We'll add.
Thank you
Note
very
there.
much. CD1 forms, which I believe are a type of complaint form used by other agencies like FEMS to alert OUC of issues, should also be included in that list.
CD1s are not our form. The fire department uses those, and any thing that we get comes from our liaison officer, and we have historically included those. OUC doesn't get the CD1s directly. I think Chief Donnelly could better answer this, but it's my understanding that in the field, they fill out CD1s, it goes up through a process, and then if there's a concern about dispatch, then the battalion chief assigned to OUC works with our 911 operations chief. So I don't know that we see those forms per se.
Okay, so, but similar to the call to dispatch times where we need the buy-in from other agencies to meaningfully share that information because it's not all within OUC. CD1 forms feel similar to that, and that while it's FEMS, it still should be part of the public dashboard.
Okay, can I do a little more research on the CD1s and how they collect them and what that means, if that's okay?
Yes, absolutely. Okay, TCPR, in your pre-hearing questions, you stated that in FY 2023, the agency achieved 89% accuracy in identifying the need for TCPR, starting CPR timely and giving exact CPR instructions. My understanding is that the American Heart Association considers those three metrics to be separate. So can you share the percentage for each metric and what percent of calls was the need for TCPR correctly identified?
We'll have to get you that information. A team of paramedics from FEMS actually reviews all of our CPR calls. They're the ones that do the quality assurance on them. So we'll work with that team. They're in our building. They're closely interlaced with us, but we'll work on that
Okay,
and get that to you.
thank you very much. So the nurse triage line is a great thing in the district, and I know that you all are taking great strides into improving the diversion to the nurse triage line. In our pre-hearing questions, we requested a breakdown of how many calls were transferred to the nurse triage line since it began in April of 2018. I don't believe we received that information. Do you have that with you today in the last 3 years?
So actually, the nurse triage program is a FEMS initiative. And so they are the ones who collect all of that data and everything. So I can't, because what they handle is going to look different than what we handle because their providers have the ability to contact the nurse triage line from the field. They send us a report every Monday, but they are the data purveyors of that, if you will.
Right. But when they send the information back to OUC, is that not something that you track?
So when we make something for the nurse triage, I can tell you if we code it as nurse triage, I can tell you what that looks like. But if they send it back, it doesn't come to us, they typically send it right to AMR dispatch as a BLS dispatch. So we can work with them to get some data and get that to you so that it's accurate, if you will.
Okay, thank you.
Mhm.
I guess just as we're looking at eligibility for diversion, it would make sense for OUC to be involved in that tracking, to see if it needs improved training or resources to ensure
Sure.
that it's being utilized properly.
The report that they send out does show, they take a sampling of what could have been nurse triaged. And so we do have eyes on that, and they do come over and do continuing education with us on nurse triage.
How does OUC work with neighboring jurisdictions for fire, medical, and police agency issues?
Sure. So I'm actually the subcommittee chair for the national or for the Metropolitan Washington Council of Governments 911 Directors. Each state has a representative. I by default am the one for DC. And so what we do there is we talk about an array of issues. There is the CAD to CAD program that is run that other places use for fire in some cases. And I do represent on a committee the interest of DC 911. That committee is going to have its first meeting since I've been on that in the next week or two. But as far as how we handle it right now, it's a lot of phone calls back and forth. So if there's an incident like on Eastern Avenue or something like that, we are making a lot of phone calls. If we're taking calls that are meant for other jurisdictions, we will transfer those. And then also under that same subcommittee group, Washington, DC is the training hub. So we host training all year for everybody from the region. So that's what our work is there.
Okay, great. Thank you.
Mhm.
So for 311, it's my understanding that improvements are coming to be implemented this spring. And I want to see if you all are still on track for that and if the changes contemplated I'm going to be passed soon in Secure DC can be incorporated into that update so that we don't have to wait for a whole nother round
Sure.
as the second vote will be on March 5th. And so we'll have a, sure sense by then what will be in the legislation. But my anticipation is that it will be as we passed it on Tuesday. There had been no pushback or conversation about changes to 311 from my colleagues.
Sure. So some of the changes that were in the legislation have actually already occurred. And I'm going to turn to Chief Marcellus Walker, who's our 311 chief.
Good afternoon. So yes, some of those changes have already been reflected in the current system. Starting next week, we'll be doing the system update to where we have to kind of do those changes in the background of development, the code, those changes that may take roughly about 2 months. Once the system comes back up, that's when it'll reflect in the new system, the opportunity for the multi-language process, Spanish opportunity for the self-service system, and also some other things that we'll be doing with the IVR to make sure that they're available in multiple languages as well.
Okay, great.
And if I could just add, I know I'll have to look at all the provisions. I know I don't know them as well as you and your staff, but the one about the National Park Service is tough, and we're going to have to figure out kind of what that looks like, because there's not a way for us to get that information to them, right? As a conduit in 311, we're collecting the information, then pushing it off to agencies for them to handle. But if there's not someone to relay that information to, then that kind of becomes a problem for us. So Marcellus has been working really hard with the 911 working group on how we kind of get around that. But we'll keep you updated with our findings there.
Okay, well, thank you for that. And I hear that concern, and it may just need an MOU with NPS to make sure that they have the ability and the focus to receive that information. Because from the perspective of district residents, a lot of people aren't keeping track of what's
Sure.
federal land, what's a DC park. And so they just need a one-stop shop to be able to put it in. But I hear you on that side, and we'll certainly be partners in working with MPS to make sure that they can get you all what you need.
And we've already talked, and Marcellus is going to reach out to Mr. Harrington for some ideas and suggestions. We can think something works great because we know how to navigate it. And so we just want to make sure that we have that same input.
Right, fair enough. Okay, thank you. And speaking of 311, at a violence interruption hearing that we had at the end of November of last year, the city administrator, Kevin Donahue, shared a new rollout of a warm line, a 211 referral system for folks to get more of a comprehensive set of wraparound services for victims of violence, or if someone's calling in and needs support for a loved one or someone they're aware of. And he shared that those call takers are going to be coming from 311. So what is the update on the 211 warm line, and how is that going, and how has that affected our traditional 311 operations?
They have really great employees that all came from 311 and now work for 211. But they're there. They're there. They're located at UCC. They have been training alongside of the 311 team. Marcellus was really instrumental in representing OUC there, but it's there. And so they take the majority of the calls. If there are rollovers, we have some 311 call takers who are trained, the vicarious trauma training and things like that. So that program is up and running, and there have been no concerns from OUC standpoint. We're always happy to partner with our friends and other agencies.
Okay, and how is the partnership working of who's overseeing the substantive work of those call takers?
CFSA, and they have their own, one of our operations managers now manages that program for them. So she had the knowledge of 311 and call center workings, and so went over there to launch that program, and that's all handled there.
Okay, and so how many call takers from 311 did you lose to this new program?
One call taker and one ops manager.
So did they hire other people to also do this work, or is there only one call taker for all of 211 right now?
No, they have a total of 3 call takers, a team lead and a supervisor. When they posted the position online, only one of our call takers, I guess, qualified, came up in those qualifications.
Okay. Thank you. So OUC has 4 radio channels that it monitors, letting agencies talk to OUC, request backup, ask dispatch questions. And in your pre-hearing responses, you say that dynamic regrouping of radio channels, which is a form of patching, was authorized in FY 2023 and FY 2024. I'm only raising this because I understand from prior oversight hearings that former OUC directors may have prohibited this practice, with concern that one dispatcher monitoring multiple channels could lead to a lack of response. Do you have any concerns with this happening from using patching? And if not, why do you think this was prohibited in previous years?
Sure. So one of the things, there is always going to be sometimes an immediate need to be able to do this. And, I've talked to other places, and a lot of places do this. We don't try and make this our day-to-day operation. We always try to fully staff. But for instance, the other morning, somebody on our staff had a medical emergency. They can't stay at work. And so it's 4 o'clock in the morning. We need to be able to patch 2 channels together and, answer those channels. That is a process that the radio system allows for. It's a process that we train on. I've worked at OUC since October of 2020. I don't ever remember seeing a policy saying that it was a prohibited activity. I was in operations for a little bit of time. I know that there were signs put up for certain, but as a policy, no, because there's always going to be an instance where you need to patch channels. We patch channels on FEMS and MPD pretty regularly on larger scale incidents. And so, as staffing is an issue, there are going to be times when one person's going to have to listen to 2 channels. It's never our main dispatch channel. It's never channel 1. I think someone may have said earlier that they've heard the same person on channel 1 and then on a different channel. That happens by design because they move around, because they wouldn't be able to talk at the end of 12 hours if they were just constantly dispatching fire channels or fire calls on the main channel. So they move around and they do those things. The class that we have in right now of dispatchers are all fire dispatchers. That is where our greatest need is right now. And the hope is that there will come a point in time where we will have enough people that even if there is an emergency, even if somebody has to step away for a moment, that we can bring somebody else over. Unfortunately, we're not there right now, but we're doing everything we can to get to that place.
Thank you very much. Well, Director, that concludes my questions for you today. I want to give you a chance if you have any other thoughts you want to share that we didn't get to talk about, to have the final word.
No, thank you. I just want to thank you and your staff for the commitment and dedication and really to all of the OUC employees and the public safety employees in our city who just do an amazing job each and every day. They work hard. I know it. I see it when I'm at work. I hear it and see it when I'm not at work. And, I'm just really grateful to be in this position. There are certainly things that need to be addressed. I know that. I think we all know that. And I'm really dedicated to doing that. And what I'm trying to do here is really build an agency for the ages, to put things in place that are aligned with standards that give our call takers and dispatchers the best shot at being their very best each and every day. And I'm trying to build something that is standards based, that everybody has the utmost amount of confidence in. And so I'm really grateful, to the executive for providing us the resources to doing that, and you for your partnership and leadership. So thank you to all of our employees, and we'll continue to do the good work. Thank you.
Great. Well, thank you so much, Director McGaffin, to you and your team, those with you today, and those who are doing this hard frontline work every single day on behalf of the district. We are very appreciative of it all. And just want to reiterate as we move forward to really stay focused on the importance of transparency, not just for recognition when there's an error, but for recognizing the public safety benefits of outcomes when we have a public that trusts in OUC. And transparency is a huge way to build that trust, especially when the after action reports are completed and can be shared. And one way to start with that is sharing them with the committee, and some of them with the public. So I really appreciate the recognition that we have more work to do in that regard. And we look forward to continuing to work together. I also want to thank my team for all of the preparation for today's hearing and all of the work with OUC and OCME throughout the year. And with that, the time is now 2:05 p.m. on February 8th, 2024, and we are adjourned.